Good morning, everyone, and the Joint Committee on Administrative Rules and Regs will come to order. Thank you, everyone, for being here this morning and for joining us online as well. And with that, then, we need to take a look at the minutes. And is there a motion regarding the minutes from our August 12th, 2024 meeting?
I move we approve thank you, Madam Chair. I approve the minutes of the last meeting of the JCAR.
Thank you. And is there a second? Senator Francisco. Any discussion? Then you all have heard the motion. All those in favor signify by saying aye.
Aye.
Those opposed, no. The motion carries. Thank you for that. And with that, then we will invite the State Board of Pharmacy to the podium. Thank you. And we will then invite Bradford DeYoung to the podium where he is right now. And please introduce yourself and welcome to committee. Can you make sure your microphone is on and then start over? Thank you.
You know, it happens to be the first person.
I'm going to say that as part of the, please introduce yourself, turn on your microphone, and welcome to committee.
Yeah. Well, good morning, Madam Chair, members of the committee. I'll try this again. My name is Bradford DeYoung, and I'm an attorney with the Kansas Board of Pharmacy. Absolutely. I am trying so hard this morning. Well, first, I'd like to thank the committee for allowing us this opportunity to provide testimony regarding the regulation KAR 68720A. While I'm sure many, if not all of you, have had the opportunity to read our written testimony, I do want to quickly touch upon a few different things that I didn't really touch on in the written testimony. So first, I want to make this abundantly clear. This is not the same regulation that you saw back in March of 2023. I know it bears the same title, has the same number, and even covers the same subject matter. But I promise you that the regulation from March of 23 to this year is about as similar as apples and bananas. They're both fruit, but we're not going to be confusing the two of them anytime soon. Which brings me nicely to my second point. Why? Why did the board alter this regulation so much? Well, quite frankly, the board did it because of the feedback we received from this committee and our stakeholders. The board is listening. The board does listen. So when we go before our board meetings, we link them to the YouTube video so they can actually listen to the feedback that is provided. I wouldn't say real time, but from the past. But we also provide them the letter as well. So I wanted to make it clear, the board does listen. So the board then took this regulation back to the drawing board. And with more than quite a bit of assistance from our stakeholders, we have drafted a new regulation that we are putting before you today that I think all of our stakeholders agree is superior to the previous version. So I want to now touch on the question, why now? Well, and to that I have two responses. One, because 10-ish years ago, this wasn't a thing. This idea of having specialty pharmacies dispense drugs or deliver drugs to an administering facility, that didn't happen 10 years ago. The pharmacy practice is continuously evolving, and the idea of just having one or two or even three specialty pharmacies compound and deliver almost all of the drugs for administration to a hospital, that wasn't economically feasible at the time. But economies of scale have changed, and now that is the current practice. The other reason is that our authority has also changed. And this actually happened back in 2021 with Senate Bill 238. And that Senate bill updated the definition of dispense, something that is very important to the pharmacy practice, to include delivering prescription medication to a patient by mail, common carrier, personal delivery, or third-party delivery to any location requested by the patient, which clearly shows that the legislative body intended for us to ensure that when a pharmacist handles, compounds, dispenses a drug, their job is not done until the drug reaches the patient or anywhere the patient requests. So just because the drug leaves that pharmacy doesn't mean that they're done. If it's going to be administered, it needs to make its way completely to the administration site for administration. Finally, I want to touch upon the fact that Kansas is not alone in this endeavor. As of today, several states have introduced, and many of them have adopted legislation regarding this delivery of prescription drugs to an administering facility. States like Arkansas, Louisiana, North Dakota, Tennessee, Vermont, Minnesota, and Texas and Virginia have all introduced legislation regarding this topic. However, I will also say that each state has their own idea on how they want to administer. Some of them introduce safeguards. Some of them are more stringent in what they allow. Some are what they require. So each state has had their own take on how they will address this practice. But it's not just legislation, it's also regulations as well. States like both Delaware and Virginia have introduced and adopted regulations on this topic. So I think it's clear that Kansas will be joining several other states in protecting patients. With that, I'd like to thank you for taking this time to allow me to discuss this regulation with me. I know the written testimony goes into a lot more detail about the particulars of this regulation, but I'm happy to answer any questions you may have about it here today.
Well, thank you, but could we have some clarification on the change that this regulation proposes?
Absolutely. And first off, I should note that it's not just an amended regulation, it's a brand new regulation.
Exactly. So could you explain what the new procedure
Absolutely.
and practice would be? Because you said written testimony, but I think what we actually have is just the proposed regulation. Is that correct? Or, okay, there's a letter too. Got it. Thank you. Yeah, so could you explain what's being proposed by the Board of Pharmacy since this is brand new regulation? Thank you.
Absolutely. I'd be happy to. So, first and foremost, once again, we're talking about specialty pharmacies delivering drugs to administering facilities for administration. So, I want to break that down into more of a layman's term because that's the easiest way I understand it as well. If you have a pharmacy that particularly compounds compounds drugs like chemotherapy drugs, something that is very specialized for each individual patient. I mean, if you have anyone in your life who has dealt with cancer, you probably know that each treatment is very unique to that patient. And the doctor is the one who prescribes that treatment. Well, 10-ish years ago and before, what would happen is your doctor would prescribe it. The hospital pharmacy would then compound that drug, that cocktail of chemotherapy drugs, and then would administer it at that same hospital. But that's not what happens now. Right now, what we have is specialty pharmacies who do that compounding. So it's a middleman step. And like I said, it's economies of scale, so they have the opportunity to do this at a much greater level. They have all the facilities to do it, and then they ship that drug to the administering facility. So that's the overall concept of what we're working with. The problem would occur is that you would have instances where they would ship the drug to a hospital, a drug that is oftentimes very temperature sensitive. So if it was left out in hot temperatures or if it wasn't refrigerated almost immediately, the drug could spoil, which meant that if the drug spoiled and it was administered, there is a greater chance of that drug causing more harm than good to the patient. So I just want to set the background here, because what would happen is the specialty pharmacies would send it to the hospitals and they wouldn't notify anyone. And sometimes the drugs would just sit there on a loading bay or anywhere that the drug was delivered to at the hospital, and no one would know. And it could sit there for 10 minutes or 10 hours. And that's the real problem because we're talking about drugs that are temperature sensitive being left in Kansas heat and Kansas cold. And that is a massive issue for the spoliation issue for drugs. So, with that, the board decided to, and with the legislative authority change, decided to address this issue. And by doing so, what they have done is they have clarified that the specialty pharmacies, the ones who are making the drugs, must maintain policies and procedures that include things like record keeping and identifying the pharmacist that is responsible for delivering the prescription, dispensing the prescription, and counseling the patient. The mechanism for the administering facility to track the prescription during delivery, which touches upon the fact that now when the specialty pharmacy ships it, the administering facility should be able to know, hey, this is supposed to be arriving today at 4 p.m., just like your Amazon package would. The specialty pharmacy must also ensure the accuracy, security, integrity, and accountability of the drug during the delivery process. And the specialty pharmacy must inform and obtain consent from the patient for using this dispensing and delivery process. Now, that's just the policies and procedures level of it, which we allow them to, as long as they maintain these areas, how they would like to achieve that, we leave to them. Now, on the other side of it, specialty pharmacies must also ensure that drugs that are waiting to be picked up or in the process of being delivered must be stored in accordance with manufacturing requirements. So once again, that goes back to ensuring temperature and any other manufacturer requirements are met. Some of the chemotherapy drugs are light sensitive, for example. The specialty pharmacy must also notify the administering facility of when and where the drug will be delivered and provide a procedure for returning any unused, unadulterated drugs that are not administered to the patient. This is something that many of our stakeholders wanted to address to ensure that there is no drug waste. And finally, on the administering facility side of things, the administering facility must ensure that each drug is stored in accordance with the manufacturer's requirements. So this is really what it's a very broad strokes, but we're trying not to overregulate, but we're trying to make sure that the core issue, which is these drugs being delivered, is addressed. Because otherwise there is a large risk to both public safety as well as the patients who are being treated for these illnesses that require these very specialized prescriptions.
Thank you. And you had mentioned statutory authority. Do you have a citation for that?
Yes, I do. It will actually refer back to the definition of dispense, which is 65-1626. I believe that is letter. I believe it is now letter Q. And that is dispense. The definition was changed in 2021 with Senate Bill 238. Dispense or dispensing means to deliver prescription medication to an ultimate user or research subject by or pursuant to lawful order of a practitioner or pursuant to the prescription of a mid-level practitioner. And then this is where the change occurs, including but not limited to delivering prescription medication to a patient by mail, common carrier, personal delivery, or third-party delivery to any location requested by the patient.
Does your economic impact study discuss for the patient, does this increase their cost or impact their coverage with their insurance company or out-of-pocket expense?
From the studies that we received from our stakeholders, there's a study by the Moran Company that we reference in our economic impact statement that would actually suggest that this could potentially lower patients. And by that, I mean, let me first explain that when a patient receives a drug or a prescription through a specialty pharmacy, it may cost something like $15,000. And that is actually the average from 2021 of the top 20 drugs. So the hospital acquisition cost through a specialty pharmacy cost approximately $15,000. If that hospital was to constitute or compound that drug from their own stock, that hospital oftentimes charge, and I'm going to pull up the exact number here, on average, $67,632. So we jumped from specialty pharmacy delivery of about $15,000 per prescription drug to hospital constituting it at $67,000.
Thank you. And you mentioned stakeholders, and I do see we have, and I'll let committee know and those following along online, we do have written testimony also from Walgreens, the Kansas Hospital Association, LMH Health, Advent Health, and KCHP. Do we have any testimony, or were stakeholders in the insurance industry contacted as well?
Yes, actually, we met with several stakeholders, including PBMs or pharmacy benefit managers. So those would be the individuals who are primarily, as far as I'm aware, primarily responsible for being the bridge between insurance companies and the hospitals and the pharmacies. So we met with them. That's actually who provided us the Moran report that I referenced in our EIS.
Thank you. Committee, other questions? Senator Tyson?
Thank you, Madam Chairman. So how does this impact out-of-state pharmacies that are mailing to Kansas?
Sure. So first and foremost, and thank you for the question, out-of-state pharmacies who deliver, these specialty pharmacies who deliver into Kansas would be required to follow the same rules, because if they are shipping drugs into Kansas, they must be registered with the Kansas Board of Pharmacy. So they still have to follow this regulation in the same way they have to follow all of our other regulations for pharmacies shipping into Kansas. I actually also have the number of approximately how many pharmacies ship into Kansas, if you'd like to know that information.
Thank you, Madam Chairman. I would like to know that information. It seems that there are other businesses getting into pharmaceuticals that have not been in it before, and I'm curious. I don't know if you saw a recent news report that Kansans and others have come under the medication isn't what they expected, or wasn't quality, or was even harmful. So thank you, Madam Chairman.
Thank you. Committee, other questions? Representative Penn.
Thank you. Excuse me. Thank you, Madam Chair. And thank you for being here today, sir, with just quick questions, a few, if I may. Where you went down the key aspects of the proposed regulation, thank you for going through that. When it says that the specialty pharmacies must maintain policies and procedures, you went through that piece, and there's a lot of shall or must language here.
Yes.
Is there a standardized format that the agency is proposing to track this, or does everyone just do it their own way? Does that cause confusion, or does it lead to a lack of data being tracked accurately?
So to answer that question, first off, I'd like to say that when I mentioned that our policies and procedures, we allow each pharmacy to create their own policies and procedures that are narrowly tailored to their own practice of pharmacy. So that way we're not imposing a single set that may be something that doesn't fit. And we're not trying to do a one size fit all. What we are trying to do is ensure that they say, hey, here's the area that we have to create within. Let's create based on our own needs. And then our inspectors, when they do our routine inspections, they go through and they actually review policies and procedures to ensure that it's in place. And then if there's ever a moment where it's not in place, that's a moment where our inspectors then do their jobs to ensure that it quickly becomes in place.
And thank you, Madam Chair, if I may go a little further. So there's an inspection schedule that you have there. Your inspectors go out. I guess they have a rubric or something for what they're looking for. It's not standardized across the board. So different businesses, as you said, who are out of state may not have the same format for the information being presented the same way. Is there any penalty or for noncompliance associated with this? And when I'm going down to the lower portion, you have that the specialty pharmacies must provide a procedure for returning unopened medications. It must be stored in accordance with the manufacturer requirements. Is there a cost to the businesses for making compliance with those musts and shalls? And on the other side, is there a penalty for noncompliance?
So a pharmacy who, for example, like you said, has a return policy, is there a cost associated with having that return policy? Creating the return policy? No. I mean, outside of just general writing down what that policy may be, the average employee's hours for whoever designs that policy. But for actually returning the drugs, potentially, but I will note that we're talking about this is a drug that could be worth several thousands of dollars. If it's being, and this is something that they've asked for, this is the specialty pharmacies who have asked for this particular provision. If they are able to return that to their stock, then they are able to then sell that drug or dispense it, however it may be, to whoever fits within that particular criteria. So as far as the cost, we're talking about high end of maybe $100 for shipping versus a drug that costs $15,000, $30,000. It's very different in scale.
And thank you for that. I may have been unclear. Is there an added cost to the business to ramp up to be compliant with what your new regulation is stating? So does the business have to eat a lot in order to be compliant with what this is requiring now?
When we inquired with our stakeholders, we received no feedback that would suggest that this would cost anything beyond normal cost of doing business.
Thank you, Senator Francisco.
Thank you, Madam Chair, and thank you for coming back to us. My understanding is that the pharmacy has the responsibility for the communication with the patient about how this works, what also they should be thinking about. Do you take this with food, without food? So those specialty pharmacies are taking on that responsibility for communication.
Yes.
And then in reading through the testimony that we've received, clearly there's the comments that these regulations move us forward, but there are also concerns about this process of white bagging, that this is happening because a insurance payer insists that a particular administrating facility or a hospital use a particular pharmacy?
Yes. So when we met with stakeholders, first off, we have to work within the confines of our own authority. So really, when it comes to insurance, that's outside of our authority. We can't mandate who has to work with who. But what we can do is ensure that in the process of them working together, that it will mostly deal with the safety of the patient, which is why we focus almost exclusively, actually really exclusively, on the safety of the patient. We don't get into payors or who must work with who or what pharmacy is required to work with what. That's outside of our jurisdiction, unfortunately.
Thank you. So I understand and accept in your testimony that this will reduce or eliminate drug waste due to its spoiling.
Yes.
Because of maintaining the temperatures. I still am concerned about the prescription medications being not administered to the patient. I believe that they should be returned to the pharmacy, but you just described these medications as being unique to each patient, and so it may be very difficult to administer them or change them for another use. So I think that is less of a way that we'll see decreased costs. But thank you, and thank you for working with the other stakeholders.
Thank you, Senator Faust-Godot.
Thank you, Madam Chair. Thank you for your presentation. So would you please clarify when you stated that this process would deliver the medication directly to the patient, but did you say that and did you say that the patient could administer it themselves?
If I may, I
Thank
think
you.
I'd like to clarify that. No, these drugs are not being sent to the patient. These drugs are being sent to the administering site. Oftentimes that'll be a hospital or a clinic. And then the clinic or hospital staff will administer it to the patient. So that would be your oncology unit, who would then have oncology nurses who would then provide the administration. The patient will never, according to this, would never be doing it themselves. This is entirely within specialty pharmacies to administering facilities.
Thank you. Committee, any other questions? Not seeing any. Well, thank you for revisiting this and taking the committee's comments, suggestions, and recommendations into account and consideration when proposing this reg. Appreciate that. And talking to stakeholders as well. So committee, then we are ready to hear from, if there's no other business of the Kansas Board of Pharmacy. Thank you. Thanks for being here. Appreciate it. We will hear from the Kansas Corporation Commission. So Mr. Lateef, please introduce yourself. Make sure you turn on your microphone, and welcome to committee.
Okay, can you hear me on the microphone? Okay.
Might need to be a little closer so we can make sure those following along online can hear as well.
Okay. Good morning, Madam Chair, committee members. My name is Hassan Lateef. I'm a litigation counsel for the Kansas Corporation Commission, and today I'm here representing the KCC's Transportation Division. The KCC is the state agency charged with implementing rules and regulations affecting motor carrier operations. Just as you know, motor carriers are commercial, they operate commercial vehicles that are over 10,000 pounds in the state of Kansas. So cabs or small or Ubers are not under our authority, but we regulate vehicles that are large trucks, large vans, and tow units, things like that, that are over 10,000 pounds. So that motor carriers have the same experience when they're traveling through different states. Our federal counterpart, the Federal Motor Carrier Safety Administration, has federal regulations that are, it asks us to adopt within 3 years of them being promulgated. And then when we adopt those, then states, different as motor carriers travel across states, they have the same rules that apply to them. And they incentivize that by providing MCSAP funds. That's Motor Carrier Safety Assistance Program funds that are used by the state, by the Highway Patrol, and by our staff to enforce safety and provide enforcement of the rules that we do. So we have 5 regulations that changes to present to you today. Each of the regulations are not substantive changes over what we've done in the past. They adopt new versions of documents or federal regulations that to replace the previous adoption. And those are the major changes in these regulations. So I will take you through those regulations, and I'm happy to answer any questions as we go. I also have the Transportation Division Director, Mike Hamey, here as well, and he's available to answer any technical questions that you have. So the first regulation is KAR 8241. This regulation defines the terms that are used in the motor carrier regulations that we have in the state of Kansas. And included in those definitions is a definition of the term out of service, or OOS. That's the designation that the Highway Patrol or motor carrier inspector gives to a violation that is a major violation found during a roadside inspection. That would be a taillight being out, headlamps not working, or brakes not working in an effective manner, or perhaps the CDL, the driver not having CDL when driving a CDL required vehicle. So those are major violations, and those are considered out of service violations that have to be corrected before the vehicle can move on from the inspection. So the document that we adopt a document in this regulation that informs what an out of service violation is. It's called the North American Out of Service Criteria. And this document is updated annually. And so we're adopting the 2024 version of this document, which is the latest available version of the document. And that's the change for 8241. For KR 8243B, this regulation adopts portions of the federal regulation 49 CFR Part 40. These deal with workplace drug and alcohol testing programs that affect motor carriers. To give you an example, this defines what a US DOT drug test is. It gives the procedures for if a driver has a test positive for a controlled substance, what the return to duty process would be. This adopts the new version of that federal regulation, and any changes that are required for us to make that change are involved in this. Sometimes that's if we adopt a portion of the regulation, we have to change the wording in our regulation. For 8243C, this is also adoption of a federal regulation. It also involves drug and alcohol testing, but this has to do with employers, the motor carriers, and how they do their testing of their drivers. They have to perform certain queries before they allow a driver to perform safety-sensitive functions, which is driving for them. So they'll have to do a pre-employment inquiry, and they'll have to do annual queries, and they also have to have their driver do a drug test. So these types of regulations are involved in this one. And this, again, is adoption of a federal regulation. KR 8243I, this regulation adopts portions of 49 CFR 393. This involves parts and accessories necessary for safe operation of a commercial motor vehicle. But the federal regulation sets out a number of technical standards for what a minimum standard for a certain part of the vehicle. So they'll have minimum standards for what a taillight is, what a windshield is, and we just adopt that so that we have a minimum definition of what those parts are. And so we're adopting the newer version of that federal regulation. And finally, 82430A. This regulation adopts portions of regulation and statute that have to do with the Unified Carrier Registration Program. Unified Carrier Registration is typically called UCR, and it involves fees that are paid by motor carriers traveling interstate. So carriers that don't travel interstate do not participate in the UCR fee registration, but those that travel across state lines do. Kansas has the highest participation in the UCR. We have 99% of our carriers who pay their UCR fees before they travel interstate, putting them we're the highest level of compliance in North America. And this puts them at an advantage when traveling across state lines, because if they're traveling in other states and they're found to not have UCR fees when they're at a roadside inspection, they'd be subject to a fine of $300. But because our motor carriers in Kansas are compliant with this regulation, they don't face those fines when traveling across state lines. The change here is the UCR fee schedule changes yearly based on adoption by the UCR board. So it's set nationally, and this adopts the 2025 fee schedule. With that, if you have any questions, I'm happy to answer them.
Thank you. Committee, any questions? Representative Wassinger.
Thank you, Madam Chair. When they're doing the testing, who pays for all of the testing?
Let me look. Motor carrier pays for the testing of their drivers.
Okay, if you're a solo operator and someone suspects you of driving under the influence, they'd have to pay it for themselves.
Usually they, as a part of being a motor carrier, they would have a contract with the drug consortium that would do random drug tests in a certain period of time. They would occasionally be drug tested. They'd get a text and they'd have to go in to submit to a drug test with a certain number of times a year. And so part of doing business is having that contract with that drug consortium and making sure that you're testing negative throughout the year so that drivers are clean.
What is the cost of those drugs, if I may ask?
Of the drug testing programs. I think it varies depending on the number of drivers you have. But
I mean, per test. You don't need to give me the.
Don't have that. I can get that information to you.
Thank you. I'd appreciate that. Thank you.
Thank you. Representative Wagner.
Thank you, Madam Chairman. I'm a small business owner. We have vehicles that are, we do our own deliveries, and so I'm somewhat familiar with this. I do wonder that there is no difference, once you hit the 10,000 pound, gross vehicle weight level, it's the same regulations all the way up to some huge, 18-wheeler, and such. Have they ever thought about doing an intermediary step? I mean, I know like with CDL is required at 26,000 pounds and above. I mean, why are not those are awfully small trucks. I just wonder what is the rationale behind having it the same for a very small delivery truck versus some huge 18-wheeler?
Like you said, there are some changes that are based on whether or not they're 10,000 to 26,000. And then when you get to CDL class, there are some changes between those two. But I don't, do you want to take that?
Madam Chair, I'd be more than happy to answer that if you don't mind.
Sure, please go ahead and introduce yourself.
Sure. My name is Mike Amy. I'm the Transportation Director of the Corporation Commission. So back in 2014, 2015, we did take a big step in doing some of the things that you're asking for the smaller business, smaller vehicles. In Kansas, the private motor carriers that operate commercial vehicles 10,001 to 26,000 pounds are exempt from almost all the safety regulations except for 3: annual inspections, cargo securement, coupling devices. So we have tried to take advantage of all the federal variances available for our Kansas commercial vehicle operators.
If I could follow up. So it's just, of course, we drive all across the U.S., doing our deliveries. So it's because we go out of state that we get stuck with just the same. Is that correct, or is the variance you made in 2014 applicable to us?
If for your wholly intrastate operations, that what I just mentioned would be available to you or any other private motor carrier. If you're operating interstate commerce, then you are going to be subject to all the applicable safety and substance alcohol testing (CDL) rules, depending on the size of vehicle you operate. And like I said, like Mr. Lateef said, 390.5 gives a definition for safety, starting at the 10,001 pounds for the commercial motor vehicles. The commercial driver's license has a definition for that class of vehicle, which ranges from 26,001 pounds or more, or any size of vehicle that may be transporting packable quantities of hazardous material. And then it gets into the passengers too, depending on what size and how many passengers they're carrying, including the driver. So there are different levels based on what you do and where you go.
All right. Thank you, Butch, for the explanation.
Sure.
Thank you. Representative Penn.
There we are. Thank you, Madam Chair. With the drug testing, did you say that it was randomized, or do they know when it's coming on the schedule?
The drug testing consortium, that is, when you sign up for a contract with the consortium, you have random tests and you get notified by your. Usually, they let the employer know, and the employer tells the driver that they've been chosen for random testing.
Okay, and then that's kind of short notice. Is that correct?
Yeah, they want it to be short notice.
Okay, thank you.
Thank you. Committee, any other questions? Not seeing any, then thank you very much for your testimony today and appearing in committee. We appreciate it.
Thank you.
Thank you. Committee, we will now hear from the Board of Nursing. Carol Moreland, Executive Administrator. Please introduce yourself after you make sure your microphone is on, and welcome to committee.
Can you hear me?
Yes, perfect. Thank you.
Okay. I'm Carol Moreland. I'm the Executive Administrator for the Kansas State Board of Nursing. And thank you for letting me come today. I have several regulations that we're, proposing revisions to. So I'll just go through each one and overview what the change would be and basically why the board wants to do that change. The first we have is 60-3-114. This has to do with a refresher course Our regulations say for an RN or an LPN who's had a Kansas nursing license, but they have let it lapse for 5 years or more, that in order to get their license reinstated, they have to complete a refresher course. And that basically is for public protection because, as I think probably all of you know, healthcare changes very fast. And over 5, 6, 7 years, there's been a lot of changes if they've not been in practice. So the changes that we're basically proposing here is they have to have didactic instruction and clinical instruction. We are not changing the number of hours of didactic instruction. However, we are decreasing the number of hours of clinical. Reason being is everyone is feeling the nursing workforce shortage. So we want to make it easier to get the nurses out faster. And actually, what we were requiring before was on the high end of what you would see actually across the nation. So we took a look at that, and what we're proposing for the RN is take the clinical hours from 180 to 120. And then 96 hours of that would be in acute care setting and 24 hours in the setting of choice. Now, we do not administer the refresher courses. That is done through vendors. And so as far as clinical settings and stuff, the actual nurse that's going through it works with the vendor. It's typically, at a facility here in Kansas, they have a preceptor and stuff there. And then for the LPN, we are proposing to take the clinical hours from 180 to 90. And then they can be in acute care or skilled nursing of their choice. Reason being is some of the LPNs are very clear. I do not want to go to acute care. All I'm going to do is work long-term care. So it was felt like, fine, let them do their clinical hours in long-term care if that's where they want to work. For those that maybe are going to go into acute care, okay, then we're saying, that they can have those hours in acute care. We're giving them some choice, basically, that they did not have before. We're not changing the requirements for the didactic or anything like that. Those are the two changes that we're proposing in this one. You just want me to go on, or?
We'll stop there for a moment if we have any questions from the committee. Senator Fausto.
Thank you, Madam Chair. So, does this also include the requirement that you're sharing for traveling nurses?
If they're licensed in Kansas, that's the key right there. If they have their license outside of Kansas and they would be traveling into Kansas, on maybe a multi-state license they got from another state, then no, we have no regulation over their license from that other state. So.
Thank you. Representative Carmichael.
Thank you, Madam Chair, and thank you for your explanation. It just caused me to have one point of curiosity. If I were coming back into the profession and I announce that I think I'm going to do elder care, and I'm not going to be working in an acute care setting, and so I get my hours, my emphasis, whatever, in elder care, can I then turn around and staff the emergency room?
Yeah, that's a very good question. Realizing that the employer also, once they have hired this nurse, they have a responsibility then to make sure that the nurse is competent for that area. So they would be assessing their competencies, their skills for that particular area. So there is another level that would take place there.
I have to admit that in my, former profession as a lawyer, we had the same situation with our continuing education, that I could go get 12 hours of continuing education in marijuana laws at the National Organization for the Reform of Marijuana Laws, and then come back to Kansas and practice civil law. So I think this is no different than probably what exists in other professions. Thank you.
Thank you. Representative Penn.
Thank you, Madam Chair. And on the heels of the good representative from Wichita, I wanted to ask a similar question. I understand that you give them choice, right, on some level. But if we're having the shortage and they aren't being required to have the training to recertify after the 5-year mark, do we basically put ourselves in a situation where we have more of a shortage of nurses who can operate in a certain field or be utilized in, like a cross level?
Um, I'm not really sure how to answer that. I don't know that it would probably contribute to it, but I guess there's always that chance. We basically did this so that it would make it easier and faster for the nurse to enter the workforce. Most of them, I tell you, when they call us, and they're like, I let my license lapse 7 years ago, but I want to get it back. What do I have to do? They're very upfront. I need some training. I need some clinical experience. And they do not want to go to the employers and say, I haven't been licensed for 7 years. This way they can go and they've had some didactic and some clinical understanding that it's probably not going to be everything, all the skills and everything they would need in that area. But it was felt that these changes would help the nursing workforce, hopefully by making it so that they could enter back into the workforce easier.
Yes, ma'am. Thank you, Madam Chair. I really appreciate that answer. Thank you for taking the time to explain that. Thank you.
Thank you. And with the return to being licensed, are we ensuring patient safety at the same time, even though we're lowering the amount of clinical hours and such?
Yeah, we would. We haven't changed the requirements of what they have to accomplish during that time. They just don't have to do quite as many clinical hours. And again, then part of that falls back on the employer to assess that they do have the skills that they need for the emergency room or for long-term care, wherever they're being hired. That responsibility is there now for nurses. If they get an RN and that RN goes into the setting of emergency, that facility is also going to check their competency to make sure that they have the competencies for that area. That's very common for employers to do that.
Thank you. Representative Wagner.
Thank you, Madam Chairman. You mentioned that the 180 hours was kind of on the very high end on a national basis. So, like our surrounding states, what are they kind of at as far as number of hours for a refresher course?
They fall more into the 90. I will tell you, though, not all the states actually have the requirement for a refresher course. Some will let their nurses come back and reinstate their license without further, a review of their education and some clinical skills. But our board did not want to go that direction because of public protection.
But do you know, like, what does Missouri require, or you don't have it all?
I don't have it off the top of my head. I can certainly get that.
That's okay. I did just want to, on the economic impact, I would think this is a very positive impact. I mean, because you are reducing the number of hours, I would think the cost of the refresher course would basically drop approximately a third. It's a third fewer hours. And so I do just want to salute you and the nursing board for kind of thinking creatively in a way that's going to help both nurses and hospitals and the folks who employ nurses. So thank you very much.
Thank you. Any other questions? Not seeing any, then go ahead with the next regulation. Thank you.
Okay, the next 9 regulations kind of fit together. They have to do with advanced practice nursing education in Kansas. The requirements that we have for our advanced practice nursing programs. There's a couple reasons that we changed these. You can see that some of these had not been revised for a number of years. We probably a couple of years ago, I think, revised the undergrad. So a lot of this is going to shadow what you're going to see in the undergrad, but some changes then for advanced practice. So why did we do that? We have 9 educational institutions in Kansas that offer advanced practice nursing education. All of those also offer undergraduate. So what they were saying to us is, how come a lot of these definitions, how come a lot of these regulations are not the same because, you know, we're having to remember undergrad, we're having to remember graduate. Great point. Absolutely great point. So that plays into some of these changes. And then some of the other changes are the changes in advanced nursing practice that occurred 2 years ago. So we're getting education caught up with that. So 60-17-101 has definitions. We added definitions that you will see more now in education. These are definitions that we brought the changes to our undergrad a couple of years ago, something like that. You see that we've added a change, probably the two changes for advanced practice are on page 2, and one of them is the definition of practice hour. It no longer says just clinical, or it no longer says so many semester hours or clinical hours of clinical. We broke it down now to say practice hours, because what you're seeing in education is there's simulation hours and then there's actual practice hours. So we wanted to separate those. So it'd be very clear that you can't use half of your, what we call practice hours, as being simulation hours. They need to actually be in practice with a preceptor and a patient. And then the preceptor, we changed the definition of preceptor some. Prior to this, the preceptor is either a physician or an APRN. And those are still in there because those are absolutely very great preceptors for an APRN student. However, it was felt like anytime there's any practice hours over 750, they could be precepted with a licensed interdisciplinary professional with a health science degree at a master's level or above. Why? Okay, you're seeing a lot more in mental health. So perhaps it would make sense that they spend some time with a preceptor that has a mental health background degree, but it needs, again, to be at the master's level or above. Another one that we see is dietitians, because nutrition has so much to do with health nowadays, and we don't always have the best nutrition. So you will also see some programs will put him with that. Some will also put him maybe with a physician assistant. You will see in some of the rural areas, like in Western Kansas, if they send them out to clinics to do clinical, they may have a physician assistant out there that they're working with. So we're trying to understand that the landscape is different in Kansas, whether you're in Eastern Kansas or Western Kansas, as far as what they're going to see. And I'll just tell you, all of these changes, our APRN programs were really on board with this. And some of these are directly what they asked for. The ones, Western Kansas had very different things that they wanted in than the ones Eastern Kansas. Those are probably the biggest changes in the definitions as far as for APRN.
Thank you. Committee, any questions? Not seeing any then. Does that get through your second set?
No, I've got,
still have a few
there's
more.
like
I know you
9
said there
in
were
the second
9.
set. I'm sorry.
Okay.
So no, we're not there yet.
Right.
I can move a little bit faster. I mean, some of these do not have quite as many changes.
Right. I think, so we talked about the preceptor qualifications and go ahead and we'll get through these. Yes, absolutely. Let's hear it.
Okay. 60-17-102 has to do with the requirements for initial approval. The only big change there is we kind of expanded on what a program administrator does. What we were finding when we went out and did site visits to nursing programs is we have a program administrator that we feel needs to have time for administration of that program. However, that may not have been taking place at the educational institution. They may have had such a big teaching load in addition to the administrator that they couldn't do it all. They really could not. So they would say to us, you know, we don't really have any recourse because there's nothing in the Nurse Practice Act that says that we need to have administrative time to be able to administer this program. So we put it in there hoping that that would help them some and kind of put a little bit of emphasis on that. That's probably the biggest changes in there.
If you want to proceed and if committee members have a question, just please notify me and we'll get that taken care of. Thank you.
60-17-103, this has to do with the reapproval. And the only change that we added were a couple of additions, and that's on page 2. Again, these are in the undergrad. So this is just making it easier for the nursing programs to know that both the requirements for the undergrad and the grad are the same. So that's the only change there. And then 60-17-104, administrator, faculty. These are where we put the change of the preceptor in again, and I just kind of explained that. And then the same thing for the program administrator. That's the only change there. Okay, 60-17-105, curriculum requirements. There's some changes here. We cleaned up some of the language just a little bit, as we did in all of these, but probably the biggest change that you're going to see is on page 2, and it's C2, and this talks about the number of practice hours. Right now, it's 500. We are proposing that after March 1st of 2025, it will be at least 750 practice hours in each clinical tract. That means if I'm going into a family nurse practitioner, those hours have to be in that track. Not another one and some in this, no more. They have to be in there. And then kind of talked about, practice hours, 750 or less have to be done with a physician or an APRN. And then any practice hours over 750 may be precepted, like I explained earlier. This is not going to cause a problem in Kansas because our schools already have that. All but 2 of our advanced practice nursing programs actually at the doctorate level now, and they have to have 1,000 hours or more. So this is not going to cause a problem in the Kansas schools, anything along that line. Okay, 60-17-106, clinical resources. All we did here is just add some of the language from some of the definitions. We just kind of cleaned it up a little bit, but no big changes there. Educational facilities, 60-17-107. The only thing we added here is they need to be able to counsel their students in private. And so much is going online and stuff as far as didactic that they have to have the current technological resources to be able to support that. And that's, again, in the undergrad. And then 60-17-108, the student policies. We added some in here, but again, these are all in the undergrad. They just were not in the advanced practice before. So they're already doing those for the undergrad. And then 60-17-109 reports. We just added a few things here, again, that are in the undergrad, so they're used to this. It just wasn't in the advanced practice regulations before.
Well, thank you for bringing those to the committee today. And do we have any questions? Yes, Representative Penn.
Thank you, Madam Chair. Just one quick question. Thank you so much for your time today. When it comes to the economic impact on 60, well, let's just for sake of time, -101 and -104, you talk about the APRN programs. You put in a new program administrator. I think you made mention that before some of those programs had administrators, probably for the nursing program, but not dedicated to the APRN piece. Is there an increase in cost for them to stand that up? That's my only question.
There isn't for them because you have to also understand they have approval from us, but all of those programs have national accreditation also. And the national accreditation actually had higher guidelines than we do. A lot of what we've done here is going to bring us into more of the national trend. So they had that, but they felt like it was more support when they went to administration perhaps to say, okay, it says that we have to do this. And it gave us a little bit when we went out and did a site visit, because otherwise they didn't always allow them the time to administer the program. And I will tell you that's probably why there's been some turnover in program administrators in the nursing programs, is they're asked to do a lot more because there's not as much faculty, so they're getting more teaching time also. So it should not cost them any more money.
Thank you. Representative Wagner.
I want to jump back kind of on piggybacking off the previous representative's question. Is it not the case on if the practice hours are going up to 750 hours? I mean, if you're a nurse practitioner, do you have to pay for, I mean, I presume to have a physician that you're following around, do they not charge you for this? I mean, I'm thinking there would be some cost being incurred.
Well, they're in a nursing program.
Okay.
So that's not always no, because they're a nursing student. They're an APRN student, you know, versus just a standalone APRN. So that's the difference there, because a lot of times these preceptors have told the nursing program, yes, we will be a preceptor for X number of hours for an APRN student. Something along that line.
Fair enough.
Thank you. Committee, any other questions? Not seeing any. Then thank you for coming to committee today. We appreciate it. And thank you for your testimony. Committee, we will now hear from the Kansas Real Estate Commission. Eric Weisner, Executive Director. Please introduce yourself, making sure your microphone is on, and welcome to committee.
Good morning, Madam Chair. My name is Eric Weisner. I'm the Executive Director of the Kansas Real Estate Commission. We have two regulations before you today. The first one is KAR 86-1-5, and it's our fee regulation. The proposed amendments to this regulation increase fees for applicants submitting fingerprints to the KBI for a mandatory background check that's in state law. Currently, those individuals pay a fee of $60, and the KBI informed us back in January that they were going to increase that fee by $10. So essentially what we're doing is increasing our fee so that we can pass that along, because basically how it works is the KBI bills us, so we collect the fee and it passes through to the KBI. The other change that's in this regulation is implementing the requirements in KSA 48-3406. This law was amended during the 2024 legislative session, and the law was amended to exempt military spouses of active military service members who reside or plan to reside in the state from any licensure or fingerprint fees. So we're just, the law said that any agencies that have that are required to update their regulations. That's what that does.
Thank you. Committee, any questions? And I want to first thank the legislature for its work on helping our military service members and spouses. So, Representative Carmichael.
Thank you, Madam Chair. How much did KBI charge and how much does KBI intend to charge for fingerprints?
So the KBI charges, they charged $47. Our law says basically we can also put on some administrative fees. We don't really put on administrative fees. What we do is we add another fee because we also participate in what's called the wrap back program. So once you have a background check, you're in the system and we're alerted anytime there is a charge or a conviction against an individual. So we get that report back, and that's $3 per year. So that's the other part of the fee, and we're not proposing to raise that portion. So KBI is their charge to us went from 47 to 57. Now they have agreed to delay assessing that until we can get this regulation passed, but it did actually go into effect July 1.
And then including the wrap back $3 fee, I think it's costing you then a total of $60. And so there's $10 for you all's overhead or your own budget.
It's $13. Yeah.
Okay. All right, whatever it is. Thank you.
Thank you. Committee, any other questions? Not seeing any. Then thank you very much for appearing in committee today. And
I have one more.
Okay. Sorry about that.
I just want to split them up because they're quite different. The second regulation is KAR 86-1-10. This is our regulation related to courses of instruction. I feel like we've been talking a lot about courses today. The proposed amendments add a definition of synchronous distance education and modify standards for these courses. So in our current regulation, we have in-person courses, which basically you have to be physically present like we all are today, and distance courses. Well, it started before the pandemic, but during the pandemic, it became much more popular to have what they call the Zoom courses, where you're not actually in person in the room, but you are participating in real time. So synchronous distance education. A lot of our education providers that started offering this said, well, you know, they're distance education, but we're actually interacting with students in real time. So we think maybe there should be some different standards. And, you know, as we were having these conversations, the Association of Real Estate License Law Officials, which is basically it's a group of every real estate commission across the country, they had a working group that put together these standards for synchronous distance education. So essentially what we're doing here is adopting those standards so that it gives more flexibility for education providers to determine whether they want to offer asynchronous or synchronous distance education. If they offer synchronous, the big thing is they don't actually have to have the student have to take an exam at the end, because they assume, you know, when you're an asynchronous, you're doing it self-paced. There's no real ability to determine what the student is learning versus, you know, whether you're in person or synchronous, there's that interaction with the instructor. So that's the big thing. And then the synchronous distance education, this is on page 3 of the regulation. Essentially, the requirements are they have to make sure that the student actively participates. You know, the student has to obviously be on the video, have to have their video turned on while they're doing it. And then there's a limitation on how many students can be in the room unless there's more than one moderator. So if there's only one moderator, they can only have 30 students or less. But if there's multiple moderators, they could have more than that. So that's, in a nutshell, that's what that regulation does.
Thank you. Committee questions. Representative Penn.
Thank you, Madam Chair, for indulging me so many times today. Just a quick question. Thank you for your testimony today, sir. Question about competition. When you're doing the asynchronous versus synchronous, is there any stipulation about where the applicants or the students come from versus, you know, Kansas license applicants versus another state doing it in a distance education format? Does that have any impact on the industry?
Representative, that's a good question. So for it sort of depends. For continuing education, there is no requirement of where the school is located. I will tell you that the entities that are requesting the synchronous piece are almost exclusively within the Kansas or the Kansas City metropolitan area, because most of the entities that are offering this, you're talking about like the Kansas Association of Realtors, Kansas City Regional Association of Realtors, South Central Kansas Association of Realtors. Those are the ones that, you know, they do this. It might be virtual because some of their members, you look at KCRAR, they have members that are 200 miles from the head office, so they can do, but they want to offer this. The distance education providers that are out of state, you know, they're more on the asynchronous distance education side.
Thank you. Committee, any other questions? Not seeing any, then that's the conclusion of your 2 proposed regulations today. Thank you very much for appearing in committee. We appreciate you being here and your testimony, answering questions. Committee, next we will hear from the Department for Children and Families. Mark Altenburnt, General Counsel, is not here, so please introduce yourself and welcome to committee.
Good morning, Chair and members of the committee. My name is Tanya Keys. I'm with Department for Children and Families in the role of Deputy Secretary. Happy to be here this morning. We have 3 regulations to go through. I'll start with the regulation title 30-4610C. And the majority of our changes are really in the definition section. So that's kind of what we're going to be going through. That's the theme. So the first one, 10C, the defined term of affirmed perpetrator is being removed. DCF, when we're alongside families, currently has a 3-tiered systems of findings. We might receive an allegation, a report that we investigate, and that might either, and then our 3-tiered system is, it might be unsubstantiated, substantiated, or affirmed. So what we're proposing and I'm reviewing with you is to remove the affirmed perpetrator from that structure. An affirmed perpetrator, just, for purpose of definition and to help with context, it's in policy and statute, is a person who's determined by the secretary's designee by a preponderance of evidence to have committed an act of abuse or neglect, regardless of where the person resides, but has not been substantiated, so their name does not go on the central registry for abuse and neglect. So that's the distinction with affirmed perpetrator. And again, we're proposing removing this. We're removing the case finding of affirmed because a person who has a finding of affirmed does not go on the central registry, not applicable to the central registry. So there's no purpose and value that adds to the central registry. And for those who may not know, the Central Registry for Abuse and Neglect is it's managed by DCF, and it's really about that person. If you're substantiated as a perpetrator of abuse and neglect, you're prohibited from working, residing, or volunteering in a facility that's regulated by perhaps the Department for Children and Families or by Department of Health and Environment regard to child care facilities. Again, more context for that. We're removing affirmed perpetrator. The affirmed finding still requires the same standard of evidence, and yet that name does not go on the central registry. So by substantiating one person and affirming another, there's potential to impact these two people differently using the same standard of evidence. And that's why we are removing it. Removing affirmed perpetrator will have no impact on how we can respond alongside families to offer support and services and complete our work assessments. So there's no impact on service or support to a family. That concludes information specific to affirmed perpetrator. I'll pause, Madam Chair, in case there are questions on that section.
Yes, thank you. I think we have a question from Representative Carmichael.
Thank you, Madam Chair. My memory of this goes back better than 10 or 15 years, so there may have been statutory and regulatory changes since I was familiar with some of this. But I know I at one time had grave concern about some people being designated as substantiated, and therefore their name was going on the registry and their career could be permanently damaged because of that. Whereas other people were described as, quote, affirmed, but they weren't on the registry, and oftentimes they continued to practice. It looks to me like what we're doing now is getting rid of this affirmed category, and any time the secretary meets or fulfills the various statutory and regulatory requirements, those individuals will now be described as substantiated as opposed to affirmed, and their name will end up on the registry. Am I following this correctly?
Thank you for the question, Madam Chair. I don't know that 100% of those that in our current definition as affirmed will in the future meet the data requirement, that the elements of requirements for evidence for substantiated. That is a possibility. It's also a possibility that given the facts and circumstances, that finding might be unsubstantiated. So I'm unable to answer your question with certainty because I think it could depend.
And I appreciate what you're saying. So we may have this category of folks that today would be described as affirmed, which, if and when this regulation takes effect, there will no longer be an affirmed category to put them in. If they would have fallen in affirmed, are they now going to either end up in substantiated or unsubstantiated? Or is there still a never, never land, if you will, out there?
Thank you for the question, and Chair. Our system will no longer be three-tiered, it would be two-tiered. So the path would be unsubstantiated or substantiated. And with those definitions, there will not be a middle term or an additional alternative of affirmed. Affirmed will go away.
And I appreciate that. I think it makes pretty good sense. My final question, Madam Chair, with your leave, is so will we have individuals whose name have been brought to the attention of the Secretary for possible violations of the law and or the regulations who will now end up with no determination at all? In other words, if we're getting rid of the three categories or collapsing to two, will there be people who are out there where the complaints have been made that and they are neither substantiated or non-substantiated, and hence they go through practicing their career with the concern that one day they'll get a letter in the mail that says that a substantiated determination has been made? How does that work for the people who are the subject of these investigations?
Thank you for the question. If I understand your question, so historically, we will retain a finding of a firm perpetrator for reporting purposes and history so that we know our work alongside the family. So that, I'll call it a previous finding. And once this goes into effect, we will still know that we had work and alongside that family. So the history will stay there. But as we go forward, there will only be a choice of unsubstantiate, or if it meets the requirements of evidence, that person will be substantiated. So we'll still know about that prior report and that prior history. But going forward, there will only be two choices.
Going forward, will there be any adverse consequence to individuals who have previously been determined to be quote unquote affirmed?
Their name does not appear on the registry for as a child abuse and neglect perpetrator. So in that sense, there is no record that would impact their ability to work, reside, or volunteer in a facility regulated by the Department for Children and Families or Kansas Department for Health and Environment.
But obviously, if additional investigations were conducted, perhaps as the result of additional complaints, you're going to look back at the facts and circumstances which have occurred with this individual on earlier occasions.
Yes, the history of our work alongside that family, that at the time alleged perpetrator, would be available in all of our future assessments. We will have that information and be able to integrate that into safety planning, et cetera.
Madam Chair, on its face, this appears to be a favorable development from my perspective, at least. Thank you.
Thank you. I just want to follow up real quickly. You talked about requirement of evidence, and we're talking about by a preponderance of evidence. These proceedings to determine if you're a substantiated or unsubstantiated perpetrator, a substantiated perpetrator or an unsubstantiated alleged perpetrator. We're not talking about a courtroom. We're talking about the secretary or the secretary's designee. And I'm just curious, is there an opportunity for the um, person who's going through this proceeding? Do they have attorneys present and things like that, and rules of evidence are applied? Or I'm just kind of curious what it looks like.
Yes, thank you. Yes, this is Department for Children and Families determination regarding our investigative finding. We have definitions of what we look for in terms of, three primary for example, was there an intent to commit the act and other items.
Is it like a courtroom proceeding where there's...
Our internal procedure is not a courtroom procedure. There is an opportunity to appeal any decision that we make, but it is not, when it's at the level of the Department and for Children and Families, it is not in a court. Is our
Right,
internal
but does
administrative finding.
and does the person then have an attorney with them, or
Thank you for the question. They might have that.
they want to? Okay.
It might just be, it's based on interviews and evidence, perhaps medical information. Other items are used. A conversation occurs. Interviews do occur with any alleged perpetrator. That interview might be from Department for Children and Families or law enforcement, depending on the nature of the allegation, but that's the process.
The legislature recently created with the governor the Office of Child Advocate. And would the Office of Child Advocate be able to look into these proceedings if necessary? Do you know?
Yes, the Division of Child Advocate would, if the matter is brought to their attention through their complaint process, yes,
Right.
they would have an additional opportunity to review.
Great, thank you. And we had a question from Senator Faust Godot, and then Representative Penn, and then Senator Francisco, and then Representative Carmichael. Get in line for your questions, everybody.
Thank you, Madam Chair. Thank you, Tanya. Before I ask my question, I just want to confirm that we're still on 30-46-10.
10C, yes.
So we haven't got to, yeah. So on the same lines as the questioning by the chair, so they have an opportunity to appeal. And so if they are represented by an advocate, let's say, or like the child advocate's person, can or will DCF provide an attorney for them to dispute these such claims?
Thank you for the question. So the Office of Administrative Hearings has a process where they hear these. I'm not aware of the Department for Children and Family reimbursing for attorney fees. I can check into that to see if that has ever occurred, but I'm not aware that the department reimburses parents for their fees associated to appealing our investigative finding regarding abuse or neglect.
And then, Madam Chair, thank you for that, Tanya. So when we're changing the neglect, so we're looking at sexual, emotional, physical abuse, did we delete just being poor? Or, because at one time we had lumped just, a single mom not being able to provide or as neglect as opposed to just being poor. Thank you, Madam Chair.
Thank you for the question. Neglect is defined in the regulations as well as in statute, and it does speak to not for economic challenges or economic instability or that. So no, it does not include that currently, specifically with regard to neglect.
Thank you. Next, we have Representative Penn.
Thank you, Madam Chair. I have pause with this particular regulation that you brought forward today. I appreciate you coming today, Ms. Keys, and the reason that I have a problem with this particular change that you want to make is, well, let's talk talent pool. If someone can't do any of the things that you say here in your definition, I'm sorry, give me 1 second, let me go to the right page. When you talk about what is the definition of a substantiated perpetrator, and if their name shows up on the registry, in paragraph K, it says that they will not be able to prohibited from residing, working, or volunteering in a child care facility. Is this also applicable to those who would be foster parents or work with CASA? Do any of these types of stipulations, if you have this determination made about a particular person, does it preclude them from working with children, basically?
Our administrative finding would preclude them from, in an employment situation, from working with children who are regulated by the Department for Children and Families, or KDHE. That could also include child placing agencies doing business in the state of Kansas. I don't know the answer to CASA. I don't know their employment practices or background checks that they do. But child placing agencies would also be doing a registry check to make sure that an individual is not listed as a substantiated perpetrator within the child abuse and neglect registry.
And if I may follow up with that, Madam Chair, the reason that I bring that up is I know that there's a shortage of individuals working with our kids in the fostering system and in the child care space that we have. And I know that because there's a shortage of individuals willing to volunteer in that might have clean records, I fear that when you remove a firm perpetrator, and if someone has something that on their record, I ran for the first time against an individual who probably would have been considered an affirmed perpetrator. But if you remove that, then that person can work with kids and basically go carte blanche under the radar and utilize the work history or the acceptance by the agency to be placed into other placements around children, knowing that they have, I don't know what it takes to be substantiated, but knowing that they have a history of this type of abuse, corrupting a child by teaching or rewarding the child for unlawful, antisocial, or sexually mature behavior, emotionally abandoning, psychologically being unavailable, demonstrating no attachment, failing to provide adequate nurturance. That's like deadbeat parents as well. I know a few of those guys too. So the problem that I have is if we move this out, there's no record of this individual, male, female, whoever it might be, having this in their background. Now they're placed around kids, or now they get the veneer of acceptance or acceptability, and now they are basically being catapulted onto kids in these environments and being considered to either volunteer or be a foster parent or whatever the case might be, knowing good and well that they have all of these detriments in their history. So I don't think that this is a good change. I think that you should leave it as it is. Thank you.
And thank you, Madam Chair. If I may clarify, thank you for the information. Just to be clear, currently, and I believe this went into effect in 2016, so those alleged perpetrators who've had a finding of affirmed do not appear on the child abuse and neglect registry. So they already would not be known as a perpetrator of abuse or neglect. So if that helps you understand.
It might a little bit, madam. What I'm saying is it says the language as I'm reading, an affirmed perpetrator in paragraph C, 3 Charlie on the front page, means a person who has been determined by the secretary or the secretary's designee by a preponderance of evidence, which is a very low threshold. You actually look at evidence, you preponder it, and it's either the secretary or the secretary's designee, be it yourself or someone else in the agency. And they consider that and see, yes, this person has committed one of these acts of abuse or neglect. I think it kind of lets the agency off the hook from doing their job by removing the affirmed perpetrator designator, because there are people out there, if they don't meet the threshold of having it substantiated, as I said previously, I don't know what substantiated means. Do you have to have a police report and an investigation for that to be substantiated? I don't know. But what I'm saying is if you allow an affirmed perpetrator to slip through the cracks and give them a cloak of invisibility, that's a problem to the child population. And I don't think that's something that the governor or the agency needs. Thank you.
Thank you. And just additional clarity in using some of your phrasing that slipped through the cracks. So currently, those individuals have been substantiated there, but their affirmed name does not go on the child abuse and neglect registry. And it's the same definition for substantiated.
I don't mean to contend, but when you designate them as affirmed perpetrator, where does it go? Where is it retained? Where's that knowledge retained?
Thank you for the question. It is retained in our case records. However, the name does not show permanently on the registry of individuals who are substantiated as perpetrators of abuse or neglect. So currently, it does not show
Yes, ma'am.
on the register.
And I gather that, I understand that, but if it goes to your office, when they currently received affirmed perpetrator status, you retain it for a reason, and that reason is to discern whether or not that person should be around kids. If you remove that, now you don't have that ability to discern whether that person should be around kids. That's a problem. Thank you, Madam Chair.
Thank you.
Thank you, Senator Francisco.
Thank you, Madam Chair, and thank you for this discussion. So I don't have a question about the changes you're making, but I had a question about the definition. This is on page 3K, where it talks about substantiated perpetrator and perpetrator, and they mean the same thing. So I'm wondering why do we make that definition consistent for both substantiated perpetrator and perpetrator? It seems that this would be clearer if we just had the definition for substantiated perpetrator.
Thank you for the question. In thinking about the history, I don't know that this is the reason. What could be part of the reason that substantiated perpetrator and perpetrator as nouns or phrases are the same as historically within Kansas, there were also terms used of confirmed and validated perpetrator. So perhaps at the time when this regulation was updated, at that time, clarity was needed that substantiated perpetrator and perpetrator mean the same thing, given a history of different titles that Kansas has used in our federal reporting, such as confirmed and validated is one that comes to mind. Historically, perhaps 20 years ago, there was a term of confirmed and validated perpetrator.
I appreciate that, but hope that you might give this further consideration, just because I think we want to be very clear in our definitions. And since we're using perpetrator and we still have alleged perpetrator, I just want to make sure that we are as clear as we can be, and thank you.
Thank you for the feedback.
Thank you. Yes, next we have Representative Carmichael.
Thank you, Madam Chair. The series of questions here has unfortunately prompted me to have a few more so that maybe at least I can better understand what this process is. First, the category of people who are eligible to be designated as a substantiated perpetrator, assuming, of course, that there is a preponderance of the evidence, etc. I assume it includes parents, teachers, caregivers, foster parents, maybe CASA volunteers, even though CASA may or may not do a background check. I don't know. Is it anybody and everybody out there has the possibility of this type of a finding being made, assuming that the facts support the allegation?
Thank you for the question. The population that this would impact is information that is received by the Department for Children and Families as a report. Typically, the department receives information on persons who are caregivers. So that might be a parent, a relative, a child care provider, an employee of a child care facility in a group home, for example. Individuals who have a relationship with a child that is not a caregiver, for example, a teacher in a school district or a neighbor down the street who is not a parent, not a regular caregiver, those types of reports typically do not come to the Department for Children and Family for our authority to proceed. They might go to law enforcement if a family decides that, but the population impacted are reports that are received by the Department for Children and Families, mainly those in a parent or caregiver role for a child.
Well, for example, I have defended healthcare providers who have been the subject of scurrilous and unfounded allegations that resulted in findings by DCF of affirmed abuse. Are healthcare providers also in the eligible pool of people where DCF can make a determination of substantiated, that someone is a substantiated perpetrator?
So the healthcare providers, if their role or relationship to a child was a parent or caregiver, and they experienced an investigation through DCF, they might be impacted professionally. However, to be clear, the Department for Children and Families does not have authority to proceed with an investigation of a, I'll give an example of a healthcare provider in a primary care clinic or some type of healthcare setting who is seeing a patient for whom is not their child, not their relative. So that's the distinction. But certainly, families that we're working alongside are in many different professions or may have different jobs.
So, as presently applied, the regulations would not permit DCF to, for example, investigate a complaint that a primary care physician had asked a young woman to remove her bra and outer garments when it wasn't a necessary part of an examination. I mean, that's one of the types of allegations that I used to have to defend that were brought by and adjudicated by DCF. I think you're telling me that doesn't happen anymore?
Given the scenario, thank you, Madam Chair. Given the scenario you provided, Department for Children and Families does not have authority to proceed with a report, or not the primary authority to proceed in a report such as you described about an interaction that happened in a healthcare provider's office. We do, on occasion, if that matter was investigated through law enforcement, and law enforcement sent the Department for Children and Families the result of their investigation, that they found some type of criminal act with regard to whatever charge there might have been, we are able to enter that finding in our system, so it is also contained in our system if we make that finding. But we are not the primary investigating agency of that.
Okay, so in that circumstance, is this individual who may be the subject of an entirely unfounded claim? I mean, I've seen this happen in the context of juvenile detention facilities, where sometimes the complaining witnesses aren't the most reliable or truthful. They may have elements of secondary gain that motivate them to make complaints against caregivers. In those sorts of circumstances, would the doctor who comes in and evaluates children on a regular basis who've been confined, is that healthcare provider going to be subject to having a permanent black mark on their record at DCF because a law enforcement officer somewhere determined, yeah, I think this is a legitimate complaint, and they just reported it, and you all now make a record of it? Is it affirmed? Is it substantiated? Is it non-substantiated? Explain that to me. How does that work?
Yeah, so thank you, Madam
Uh-huh.
Chair. Thank you for this recent scenario that describes an incident that occurred in a juvenile detention center or facility.
I am not making reference to a recent situation. This is a situation 15 years ago, but that's all right.
Yeah,
But please go ahead and explain.
I apologize. I meant your recent example.
Okay.
Juvenile detention centers are facilities regulated by the Department for Children and Families. So if an incident is described to have occurred in, for example, a group home or a family foster home or a licensed facility by DCF, such as a juvenile detention center, DCF would have authority to proceed with the information that was provided.
Okay.
So that would be under our authority if it occurred in a juvenile detention, if it's described to have occurred in a juvenile detention center.
That answer is helpful. Madam Chair, I don't want to belabor this, but I do have a few more questions that I would appreciate the opportunity to follow up on here.
Sure, we're wanting to respect everyone's time, but if
I do understand
you're
that.
efficient about it, that'd be great.
So once DCF has become aware of a possible violation, that an individual is a possible perpetrator, I presume they commence an investigation. Is that right?
Yes, we do so. And depending on the nature of the investigation, it might be joint with law enforcement.
And when it comes to the point of making a determination that a complaint is substantiated or unsubstantiated, who makes that determination? Is it the investigator? Is it the secretary or deputy secretary? How does that happen? Once you've made the investigation, now it's time to decide, are we going to put this person on the blacklist, so to speak?
Sure. Thank you for your question about how findings are made. The information is staffed with a supervisor, so a frontline practitioner who's responded to the report in consultation with their supervisor makes the finding with regard to the investigation.
By the way, I shouldn't have said blacklist. That's an old term of art that shouldn't be used anymore. I don't think we have blacklists or whitelists anymore, maybe except with respect to our email. So I apologize for that reference. So this determination that someone is substantiated perpetrator is made by the investigator and somebody else after they've just read the investigation report?
Yes, it's made based on the facts and circumstances that were gathered and definitions that we have in policy of elements that need to be met.
When
in
does
order
the
to make-
subject of the investigation or the adverse determination receive notice of the allegations and an opportunity to be heard, i.e. to present evidence and to make argument to the decision maker? When does that occur in this process?
In our body of work, we hope to conclude our investigation or our finding within 30 work days, and all parties are provided notice of all of our findings. And at that time, they receive instructions on how to appeal the decision if they wish.
And the appeal, is that an appeal that's heard by the Office of Administrative Appeals, by a fair and impartial determiner with an opportunity for representation by counsel at the person's own expense and an opportunity to present witnesses and cross-examine witnesses? Does that all occur?
There's an opportunity to be heard by the Office of Administrative Hearings. I'm not as familiar with all of their procedures with regard to if and when counsel may contact them or on their behalf provide all that appeal.
Surely you understand that it is a fundamental element of due process of law to have an opportunity to know the charges against you, to have the opportunity to a hearing, to have an opportunity to representation, to have an opportunity for cross-examination, and to have an opportunity to present evidence that might exonerate the person, and to have all of that determined by a fair and impartial fact finder. And I want to know when that happens.
Thank you for the question. That can happen as we send the notice to all parties and the family and information. And at that point that they receive that letter, they can contact our agency to begin the appeal process. So that can happen as soon as they receive the letter.
To wrap this up, Madam Chair, then my other question is, so assuming there is a determination by the Office of Administrative Hearings, is there then an opportunity to appeal to the district court and the Kansas appellate courts under the Kansas Act for Judicial Review? Kansas Administrative Procedures Act. Finally, I'm to the right phrase.
It's my understanding that is a possibility. I'm not as familiar with all of those procedures that occur subsequent to the office.
Madam Chair, I don't propose to take more of the committee's time today, but I wonder if our conferee could give me the name of the person at DCF that I could contact to get substantive answers to my questions. Who should I call?
Thank you. You can reach Mark Altenbrand. He's our general counsel. I apologize, I'm not able to answer those questions.
How do I spell that last name? I couldn't understand it.
I have it here.
Okay, the chair will provide it to me. Those of us listening online may not know, but I bet we'll figure it out. Thank you.
Sure, and I have general counsel is Mark Altenbernt, Altenbernt.
Thank you for spelling that. I look forward to a substantive visit with him.
Thank you. Yes, Senator Tyson.
Thank you, Madam Chairman. The good representative has raised many questions that I think the committee would benefit from those responses, and I would like that it be submitted to the committee also. Thank you.
Thank you. I think that would be a fair and reasonable and necessary request from the committee as we put our report together from this meeting today, and something possibly that our legislative other committees, for instance, Judiciary Committee, could look at to make sure that we have fair procedures and process in place. So with that, then, I think you have 2 more regulations to cover.
Yes.
Yes, we'll
Thank
go ahead
you.
with the next. Thank
Next
you.
is 10, Roman numeral 1, and this is, we are proposing to remove infants who are born affected or having withdrawal symptoms from prenatal exposure to legal or illegal substances. We're proposing to remove that from the definition of neglect. The federal foundation for some of this information is the Child Abuse Prevention Treatment Act, and it was amended in 2016 to include pieces about the Comprehensive Addiction and Recovery Act. That federal act does not include use of substances as neglect. Rather, the act encourages and requires states to concentrate on focus of treatment and health and well-being of the infant. So that's context with the federal. The act also required, put in additional changes for states to have a state plan that goes through components of a safe care plan for that family and their new infant. And Kansas is in compliance for that, and we added all the criteria that we needed to for those infants. Through our policy, DCF is able to serve and support families and women who are pregnant and their families. And we are able to do that through a pathway called Family in Need of Assessment. So this doesn't impact our ability to reach out to families who might be pregnant or recently delivered a new baby to their family. And we want to make sure that if, in terms of working with families who are pregnant, we want to make sure that we're not discouraging or causing reservations for them if they would like to seek services for treatment, that they would not need to worry about being ultimately determined as a perpetrator of abuse or neglect. So that's the context of the federal guidance and the spirit of that. And so we'd like to remove the very narrow category of infants who are having withdrawal symptoms from the definition of neglect. They will still receive services, and if they approach our agency wanting services, that will still happen. And they will happen as an assessment, not an investigation.
Committee, any questions on that regulation? Senator Tyson.
Thank you, Madam Chairman. I do have concern over if somebody is using illegal drugs and there is an addiction with the child, and you're just saying, we don't care, we're going to go. I mean, obviously you would treat that person no matter what, but there still needs to be an investigation, wouldn't there, as to the abuse of illegal drugs?
Thank you for the question. We care very much about the families and those infants and the pregnancy. If the woman and family with the woman is approaching us wanting services as a pregnant woman, so we would still complete an assessment. We would still get to know that family, get to know what their strengths are, what level of service might they need, who in the community can help them with their treatment process that they need. So we will still serve them. What this does is it removes it categorically from a need for the Department for Children and Family to make a determination on whether or not neglect occurred. That's the distinction.
Thank you, Madam Chairman. I'm not sure there shouldn't be some reporting mechanism here, but I also have a question as to the affirmed and substantiated language being removed up above in H. It seems like some of the questions that were asked earlier could be applied here also. Thank you, Madam Chair.
Thank you, Representative Penn.
Thank you, Madam Chair, and thank you, Senator, for that line of questioning. It struck something in my mind here. When we talk about health and welfare inspections, calling out law enforcement, things of that nature, we did the case in a law dealing with an abuse of a child that was quite horrific. And I look at paragraph I, subparagraph 2. It talks about the failure of the parent or caregiver to meet that individual's responsibilities to provide for education as required by law, which will be a trigger for someone seeing something, saying something, calling out or contacting DCF to say, hey, go check on the kid. If you remove this, as well as the senator says, the person who you might suspect is doing drugs or in prenatal exposure for illegal substances, I should say, it kind of precludes that trigger of going out to go and inspect and conduct that health and welfare, at least for these two reasons. And I don't think that's something that we necessarily want to, hamstring the community with for the sake of the children. Would you agree with that, Madam?
Thank you for the question, Madam Chair. DCF does have an ability to go see that family. We have a pathway called Family in Need of Services. So, for example, infants, we have two categories: infants born affected and defined as having withdrawal symptoms that we receive from a healthcare provider. We also have another category in terms of infants who are born substance exposed, and we currently serve both families who have those presenting situations. And we go out, we complete assessments, we offer them services, get them connected to supports and treatment. So yes, we will still see these families, and we have a category of infants who are substance exposed, not substance affected.
Thank you for that, ma'am. I do appreciate that. I just still lay back on the point that if I were in the community and saw someone that I suspected of neglect of a child, if I came to you and said, hey, or to law enforcement and said, I want to report this and would like to have a response go out, not through medical, which is another hop, if you will. They have to first go be seen by a medical provider, then it makes its way to you. But if I want to go out and say, the reason that I want you to go to the house and what I'm reporting is I suspect neglect here of illegal drug use or that they are failing to, meet their responsibilities. If you take this language out, that's unsubstantiated. It's Mox Nix. And I don't think that should be something that we should take away from the community for them to be able to go and seek the welfare on behalf of a child. Thank you.
Thank you for the feedback.
Thank you, Senator Tyson.
Thank you. There seems to be a disconnect as to what you are presenting the committee today as to how the process is supposed to work and how it is actually working. Because I have called in the past and there was evidence of drug use in the household and DCF would not step in. They refused to. So that is a big disconnect from what we're hearing today. And believe me, that case ended in tragedy. So to take these out, I think would be harmful also. The process is broken and we need to make sure. I don't envy your guys' jobs. You have some of the most difficult jobs in the state, I know that. But I ask you and the secretary to please look into how this, you can have it on paper all you want, but if the child is in harm's way and DCF won't step in, we got the full circle. We got DCF wouldn't go in, we got law enforcement wouldn't go in, there was reporting, and it, like I said, ended in tragedy. So I would hate to see this rule and regulation taken out also, because this is a case that it could help save a child's life. Thank you, Madam Chair.
Thank you, Senator Francisco.
Thank you, Madam Chair. In reading this, I see that neglect has the meaning specified in KSA 38-2202. So I think that gives the legislature the full ability to decide what we want and don't want in that definition of neglect. And rather than looking at these regs, that might be the place for us to address our concerns.
With some other standing legislative committees, like we had mentioned before. So, great. We'll want to finish with our last regulation from the Department from Children and Families. So go ahead, and then after that, we will take a short break.
Thank you. Our final substantive is to remove from the language around failing to provide for a child's education. We'd like to remove that again from the definition of neglect. Matters of compulsory school attendance, or sometimes referred to as truancy, do come to the attention for the department. Again, those are categorically, we're able to address those through a family in need of assessment. Compulsory school attendance is set forth in Chapter 72. And in that, if the student is age 13 and over, those reports go from the school to the county or district attorney. If they are under the age of 13, they come to the Department for Children and Families. And again, similar that if matters of truancy are referred to different government agencies, someone experiencing that may be impacted differently by DCF making a finding of educational neglect. And so because there are a number of truancy diversion programs, and there are other ways, and schools are supporting families whose children are truant or not compliant with the compulsory school attendance requirements, those matters have other programs and pathways that are helping those families. We'd like to remove educational neglect as a specific category under neglect.
Thank you. Committee, any questions? Not seeing any. Then thank you very much for presenting these regulations and the robust discussion. It looks like there's some follow-up work to be done by the legislature, possibly on making sure that we have appropriate due process protections in place and balancing the needs of keeping kids safe as well. So with that, thank you for appearing today and for your testimony. And committee, we've been here for almost 2 hours now. We do have 2 more sets to go through of regulations, but we'll take a brief 10-minute break. Thank you. we're going to call the committee back to order. Appreciate everyone's attention and those following along online as well. Thank you for continuing to join us. And we are a little behind in our schedule. We do have a lot of work to get through today. We have 2 more departments to hear from, and so we'll get started right away. We'll hear next from the Department of Agriculture, Stephanie Kramer, Chief Legal Counsel. We also have possibly present Jeff Vogel, Plant Protection and Weed Control Program Manager. So please make sure your microphone is on, introduce yourself, and welcome to committee. You probably need to speak a little closer to the microphone so those online can hear. No. Is your microphone on? Is the light on?
Oh, it's supposed to be blue. Okay. Okay. Thank you, Madam Chair and members of the committee. My name is Stephanie Kramer, and I serve as Chief Counsel for the Kansas Department of Agriculture. Also present on behalf of the agency and available to answer questions is Jeff Vogel, who is the Program Manager of the Department's Plant Protection and Weed Control Program. So KDA is proposing amendments to 5 regulations that will implement changes to the Plant Pest and Agriculture Commodity Certification Act, which is KSA 2-2112 at SEC. These regulations will implement changes to the structure of KDA's live plant dealer licensing framework, as well as changes to licensing and voluntary inspection and certification fees. So I'll give a bit of just an overview of what this program and this act are intended to do. This program performs regulatory inspections of what the act calls live plant dealers. So that live plant dealers range from like big box stores, Walmarts, et cetera, that have greenhouse sections, to like smaller businesses that are plant nurseries, essentially. So this is regulation of plants being sold in Kansas, it's not a program that looks at just regulating whatever plants growing in someone's yard or something. It's for sales and exports, is what it's geared towards. Basically to ensure that plant pests or diseases are not present in these plants that are being sold within Kansas or across state lines as well. As obviously those, the economic, ecological consequences of if those pests were to take hold enough to cause some kind of outbreak, those consequences could be pretty severe. So these inspections and licensing schemes are designed to prevent that. As I mentioned, we also perform inspections of plants and plant products that will be exported to other states or even other countries, and provide certification that those items meet import standards for those other jurisdictions they may be going to. So moving to the regulations themselves, the proposed amendments are mostly simply aimed at implementing recent statutory amendments that provide for relatively small license and inspection fee increases, as the program has not raised fees since I think about 2011. So most of it is just nearly all of it really is just to account for both the agency's actual costs in supporting the employees that are needed to do these inspections, and then the actual cost of like some of these physical certificates and things that we issue to these licensees, as this program is entirely fee funded as well. So the regulations and the statutory amendments that underpin them were developed in consultation with the Kansas Nursery Landscape Association, the Kansas Greenhouse Growers Association, the Kansas Turf Foundation, the Kansas Grain and Feed Association, and Kansas State University Research and Extension. So I'll first discuss proposed KAR 415.5 and 415.7 kind of together. They sort of work together, and both of those regulations in conjunction form sort of the basis of the changes to our licensing framework and fees. So the proposed amendments to KAR 415.5 would increase the cost for a live plant dealer license from $80 to $100. This same regulation would also allow for a reduced license fee of $30 for live plant dealers who do not export live plants out of Kansas, do not have more than one permanent location, and do not have gross sales in excess of $10,000 a year. So then, as I said, kind of in conjunction with that, the proposed amendments to KAR 415.7 set requirements for special event live plant dealers, as the reg refers to them, to register annually with the secretary in advance of any live plant dealer event. So a special event live plant dealer is like, they're defined as like an educational, religious, or charitable institution that sells live plants for fundraising purposes for, I think it's 5 days or less per year. So it's, you know, a church doing a Christmas time poinsettia fundraiser sale or something. So those entities pay a reduced license fee of $30, basically just to account for that there is lesser inspection time required. They have only the one location, fewer plants, etc. And so this 514.7 is sort of, it does not itself impose a fee, just a fee-less registration requirement. It is sort of roped into our fee adjustments because special event dealers did previously have to pay a fee. Some of them did, depending on this, basically the scale of how many plants they were selling. So when we looked at calculating impact and revenue from these fee increases, that change got factored in, but that regulation does not itself impose a fee. Any questions on those two?
Thank you. Committee, any questions? Representative Carmichael.
Thank you, Madam Chair. I apparently wasn't paying as much attention as I should. Help me with this scenario. My church buys 100 poinsettias and we use them for the Advent service. And then afterwards, we take them to the nursing homes and care facilities and we distribute this 100 plants. Does the pastor need to worry about registering with you to do that?
No, there's no sale taking place. So.
And if there is a sale before these regs kick in at all, do there have to be sales of or estimated sales of $10,000 worth or more, or did I misunderstand?
Yes. Yeah.
Yes, there does. Yes. So long as my church is trading in less than $10,000 worth of points, let me stop. You wanted to correct something.
Sorry. So if, like in that scenario, it's like a smaller scale, yes, but the other requirements are like, so if you were exporting to other states but had fewer than that amount of sales, you would still have to register. It's sort of the export component that triggers like the heightened need for inspection. And then what was...
I certainly understand when we're talking about interstate sales and transportation of plants that it really makes a lot of sense. I don't want to get bad roses from Texas that kill the rest of the roses in my yard, for example. But so is there any de minimis standard if the church has 10 poinsettias left over and says for $10 a piece you can come get them, and so the church makes $100? Do we have to report that to D of A and have an inspector come out? Help me with that.
Okay, sorry. Mr. Vogel clarified that for me. So there is also the component that like you also qualify. I don't think I read this part of the definition, but you also qualify for the special event exception if it's basically the plant sales is not like the main point of your business. Like if you're giving them in conjunction with a sale as like a promotional thing. I guess honestly I'd have to think about where that fell under the statutory definitions, but I think the intent would be not to impose a license requirement in that scenario.
Madam Chair, I'll withhold my comments until we talk about our report. Thank you.
Thank you. Committee, other questions on those regulations? Not seeing any, then go ahead and proceed. Thank you.
So moving on, 4-15-8 and 4-15-9 work sort of in conjunction as well. So I'll also discuss those together. The proposed amendments to 4-15-8 would increase the fee for voluntary requested inspections of live plants and plant products from $30 to $45 per hour. And we did figure, just I guess as sort of a side note, that $45 an hour is approximately the agency-wide average for like supporting an inspection staff employee. So these inspections are typically performed for people who want to export plants or plant products to states or foreign countries, as those are subject to often to requirements that they be free of certain pests or certain conditions, and could in some cases be subject to heightened or different standards for import into where they're going as well. So they want to be able to provide that importing destination with certification that they are free from these conditions. So that is the fee for just performing those inspections to make that determination. And then 4-15-9 pertains specifically to the cost of the certificates or tags, we call them in some instances, that we issue for those entities to be able to show they've met those requirements, as just the actual cost of producing and providing those physical documents has gone up as well. So the proposed amendments would increase the cost of certificates issued for what it calls commodities or articles intended for domestic shipment to other states, from $20 to $30, and would increase the cost of what we call bale tags that are provided to satisfy other states' weed-free forage requirements from 25 cents to 30 cents. I'll pause. Any questions about that regulation?
Not seeing any, or except one. Senator Tyson looks like. Thank you.
Thank you, Madam Chairman. I'm sorry if I'm in the wrong area, but I'm curious about the fee going from $30 to $45 an hour plus mileage expenses. That seems like a pretty exorbitant increase.
I mean, I guess it is based on our actual needs, the agency's actual need in covering those costs. And I think.
If I may, a 50% per hour increase. Thank you, Madam Chairman. That seems excessive.
I think Mr. Vogel could help with that question, actually, if you'd like to hear more.
Thank you, Madam Chair. Jeff Vogel, Program Manager, Plant Protection Weed Control. And so the change from $30 to $45 follows the same increase in the maximum amount that was passed in the legislature in 2022. But looking back at the history of this, this program has had a $30 per hour inspection charge in place for well over 2 decades. And so we were considering increasing it to match the average cost of our, of employees, and working with stakeholders and the stakeholders that we inspect, we came to an agreement that that's where we could increase it to, since it has been such a long time and we were not covering our costs of just the hourly agency costs of the employees when we were out there conducting inspections. Just to kind of give a full explanation on how that change happened and how long it has been.
If I may. Thank you, Madam Chairman. A 50% increase in 1 year is an exorbitant increase, and I just have concern over it. Thank you, Madam Chairman.
Thank you, Representative Penn.
Thank you, Madam Chair, and thank you, Senator, for bringing that to our attention. As the chair lady said earlier, I think we were doing who was that? It was during the Real Estate Commission. Were you here for that?
I was not here for
okay.
that. I apologize.
Earlier, they were discussing some of their fees as well with their stuff, and we had done a number of different things in the legislature for the military spouses. I'm gonna read you some language, and I wanted to know if you might be amenable to making sure this was added in as well, if it's applicable. I think it would be. They had on their proposed regulation earlier this morning, each military spouse of an active military service member who resides or plans to reside in this state due to the assigned military station of the individual or the individual spouse shall pay a fee of $0 to the commission for any licensure fees or fingerprinting fees related to licensure. Now, it's not verbatim what your agency has, but in accordance with the law that we did pass, would you'll be interested in wordsmithing this to allow for that exemption or that zero fee for military spouses, so the agency is in compliance with the law?
Okay, yeah, that is something we can take back for discussion, certainly.
Thank you. And go ahead and proceed if there are no more questions, which I don't see any.
So moving on, the last regulation is KAR 4-15-10. It's the only regulation in this set that is more, I suppose you could say, substantive to the plant pest regulation rather than being fee focused. It sets out limits for certain types of pests or plant diseases that are permitted to be present basically within a group or what it calls a lot of inspected plants. And you have to be below those limits in order to receive the certificate that you can export these plants, as I discussed earlier. So I guess I would note this regulation, I know if you look at the strike through and underline, looks like a lot of changes. Most of those are stylistic. They were, the reg is pretty old. They were mostly Department of Administration changes. The main substantive things that these amendments would do is it creates an exception for plant pests that are basically are confined to one species of plant and known to be very widespread within that species and known to basically not cause harm to that plant host or pose a risk of environmental or economic harm beyond that. So we've said basically you don't have to go through the struggle of trying to control these pests if we know that they're basically out there in a large percentage of this population and they really cause no harm. And then we've removed a few diseases that we have also just found over the years of when we were regulating them that they really were not posing that large of an issue or a risk of harm. And then the reg does have, I suppose, a safeguard for both of those things as well, that more stringent standards can be applied for export purposes to prevent environmental or economic harm. So if the need did arise case by case, if we saw something, I suppose, unique that's not per se covered, we could rely on that to regulate that for export purposes and ensure, protection in that regard as well.
Thank you. Any questions? Representative Carmichael.
Thank you, Madam Chair. I'd like to turn to the exception that you were describing. It sounds like it's for diseases or pests that are seemingly ubiquitous almost.
Yes, I would say so.
And so maybe I'm trying to think what fits into this type of a thing. And I see Mr. Vogel, he probably has the answer on the tip of his tongue. I'm thinking about aphids right now. They're the bane of my garden. But can you give us an example of what type of pest or disease we're talking about that would fit within this exception, such that apparently the plant can be sold to me so I can take it home and give it to the rest of my garden?
Thank you, Madam Chair and Representative. When we looked at putting this exception in, it was in regards to looking at the plant disease side of things. There are certain viruses that are present in plants. Fig is a good example. There's certain ornamental plants that present certain looks because there are viruses in them. And honestly, over the last decade, the technology that's been developed to detect viruses in plants has expanded so greatly that honestly we're finding things that have always been present that we didn't know were there that now we do. And so because of that, we decided rather than just having a 0% tolerance for viruses in plants, because those are most of the time when we find a virus like hosta virus X in hosta, there is no cure. That plant will eventually die or it will spread to other plants, that those plants can't be sold at that point. You have to be able to call those out and you can't continue to sell those at that point. But in some cases that it is of no consequence. Now in regards to your aphid, certainly aphids can move viruses. And so we're really concerned sometimes about aphids when viruses are present too. Yes.
So this reg only applies to disease, not to pest?
It will, it's written in a way that it could apply to other pests too, if necessary. But the example that we bring forward is of a virus because that's essentially the example that we were, or at least what we were looked at prior to proposing this, to try to find a way of allowing that to continue to be sold, even though we knew there was a virus present.
So, Madam Chair, just to indulge my concern about aphids today, they kill the plant they're on, they kill the plant next to it in the garden, they kill a lot of things if you don't control your aphids. I take it they don't fall within this category, this exception, or when I go to the store, can they sell me plants that are full of aphids and be in compliance?
Aphids, thank you, Madam Chair. The aphids are prevalent widely in the landscape. And so we don't have a specific tolerance or zero tolerance to aphids because it depends on the level of infestation and if virus is present. So, and that's why sometimes writing these non-quarantine pest freedom standards, it's hard to get very specific because of the prevalence of other types of pests in the environment that are just present all the time that aren't not an issue. We're just looking at the ones that could potentially become.
I think I understand your reasoning. It seems to make sense to me, and I'll buy more ladybugs. Thank you.
Thank you.
Thank you. Senator Francisco.
Thank you, Madam Chair. And having been on the Agriculture and Natural Resources Committee, I've had a number of constituents who've asked me about their concern that if you spray milkweed to reduce pests that aren't harmful, you may change that so that when the monarch butterflies lie on it, they are poisoned. So does this, can I go back to them and say we've done something to help monarch butterflies in Kansas?
I would like to just say yes, but yeah, it's probably a you question.
Thank you, Madam Chair and Senator. So in regards, if you were a company growing milkweed to sell, there are biological methods. The representative referenced predators, or in this case, ladybugs. And there's other ones that we allow growers to utilize to control aphid populations in their greenhouse, as long as it doesn't get to an exceptional level where it would create some sort of economical harm where those plants are unable to survive. So to answer your question, yes, we approach it that way already, given that aphids are not specifically listed as a zero tolerance species on this list, but it matters the circumstances of the actual growing of the live plants. Now, milkweeds, and again, just to kind of reemphasize this, milkweeds growing in the landscape, we are not regulating with this. It is just strictly growers of milkweed that are looking at selling and distributing those.
Thank you, Madam Chair. I was concerned about the growers and especially a live plant sale to benefit the monarch butterfly population that's housed at KU. Thank you.
Thank you. Any other questions? Not seeing any. Go ahead.
That was my last regulation. That is all I have.
Great. We do have one last question, maybe more. Senator Tyson.
Thank you, Madam Chairman. I want to come back to that fee. I'm looking at it, and it looks like this inspection only occurs when there's a request made for this inspection.
That's correct.
So wouldn't us increasing this fee be a deterrent for people who actually need this information and it could be helpful? I would be less apt to call at $45 an hour versus $30 because. And how often do you get called for the request for this inspection? Thank you, Madam Chairman.
Thank you, Madam Chair. To answer your question, you're correct. It is a requested fee, and these are generally inspections conducted for export. So if there's a business perhaps near your area exporting walnut to China, our inspectors will travel there and conduct an inspection of those walnuts to facilitate the certification and movement. There's other situations, whether it's weed-free forage. If we have a live plant dealer that is selling plants and exporting them out of state or internationally, that requires a certificate from that receiving state to accept those. Those are the types of inspections that are done, not the random or verification inspection that's being conducted on live plant dealers throughout the selling season, making sure those are no-fee inspections. That's essentially what the licensing fee is paying for in that particular case. But in particular to this requested fee inspection, it is all done at the request of the client who is conducting business and exporting those plants out of state. Hopefully I answered your question. How many a year of these inspections? It varies. We've had a significant increase in those in the last 3 or 4 years and had to dedicate a lot of staff time because of the number of walnut inspections we're conducting on an annual basis from a couple different clients. But in the neighborhood of 400, 500, 600 inspections a year. Billable hours, it's above 1,000 right now. I would have to get some data on that specifically to answer your question.
Thank you. Committee, any other questions? Not seeing any, then thank you very much for appearing in committee today, and we appreciate your testimony.
Yes, thank you, Madam Chair, and thank you to the committee.
Thank you. Committee, our last department to hear from today is Department of Wildlife and Parks, and we have Curtis Ward, Chief Counsel, also expected to be present, Levi Jaster, Big Game Biologist, and ks.gov Emporia Research and Survey Office. And 2 regulations before us. And with that, then, please make sure your microphone is on, introduce yourself, and welcome to committee.
Thank you, Madam Chair, member of the committee. My name is Curtis Wired. I am the new Chief Legal Counsel at the Department of Wildlife and Parks. I've been on the job for about a month now. So I have Mr. Levi Jaster, who's a big game biologist, with me in case there are any technical questions that I can't answer. So I have 2 regulations before you today. The first is 11525-8, which extends the elk season we have on Fort Riley. So we have a population of elk that are maintained on Fort Riley. Recently, over the last few years, there's been an increase in population. The herd has been doing quite well. And so we're amending this regulation to add a January firearm season for any elk on the fort. And just a little bit more about these tags. There's about 30 of them that are sold for hunting on the fort. Half of those are sold to active service, military service members. The other half are sold to the general public. We also sell an unlimited amount over the counter for those individuals who are situated nearby the fort, who can harvest whatever. Those are unlimited, the number of tags we sell there. Does anybody have any questions about this regulation?
Committee, any questions? Not. Senator Tyson.
Thank you, Madam Chairman. Not on this regulation. I just find it ironic, and I have some constituents that are upset. In fact, I was at a parade a couple weeks ago and got stopped by a hunting group. So we're willing to increase the tags for elk, but we're not doing anything about deer. And traveling up here last night, 3 different herds of deer. I mean, I had to hit the brakes or I would have hit a deer. And it's out of control, and Wildlife and Parks isn't doing anything about it.
So in my limited time here, I have learned that is a common question that we receive here. And and perhaps Mr. Jaster can provide more information to you if you would like it. But my general understanding is that in the northeast part of the state and the southeast part of the state, we have very strong deer populations. But as we move west, they rapidly decline. Which requires different management. And of course, so as you mentioned, this is regarding elk, which is an entirely different population. If you would you like to hear from Mr. Jaster more specifically?
Madam Chairman, I don't care who answers the question. I've talked to wildlife and parks individuals that work in our areas, and they don't understand it either. They're not the ones making the decision. And I don't know who is. I know last time it used to be that you had an avid bow hunter and he wanted to protect the season for himself. At least that's what it appeared. But, you know, we could expand doe season. We talked about several things. There's several things that could happen in order to help manage the deer population and still have trophy deers in Kansas.
I guess then at this point, I would defer to Mr. Jasser.
Please come to the podium and introduce yourself. Thank you. Welcome to the
I'm
committee.
Levi Jasker. I'm the Big Game Program Coordinator for Kansas Wildlife and Parks out of their Employee Research and Survey Office. Thank you, Madam Chairman. There's a lot of stuff that goes into our deer management. We do have 18 different units across the state that we manage, each one separately from the others. In the last several years, we have been increasing the number of permits available to non-residents in the eastern part of the state where populations have increased. In the western part of the state where populations are decreasing, we have been removing some tags over time with that. Generally across the state, our residents have over-the-counter unlimited tags that they can buy as far as either sex. And then everyone, whether they're a resident or non-resident, can buy up to 5 antlerless permits that are different numbers are good in different units. So Southeast Kansas tends to be, you can use all 5 of those antlerless permits there. Southwest Kansas has been under severe drought, really poor deer populations. One unit down there, there's no antlerless permits can be used. And then other units may have one only. We are looking at changing some of those antlerless permit units around. Unit 6, which would include Marion County, several counties around that, is one area we're definitely looking at from mostly based on the damage complaints from landowners out there. We're looking at there. Now, even within each of those management units, the population is not the same. They're not equally spread across the unit. There will be some areas that will be almost devoid of deer and some areas that may have a lot more. But we are managing at the unit level. So some of that is based on our population surveys looking across that. We'd also take in social as far as what's landowner opinions on that. And then we also have solutions to landowners that have too many deer on their location, but the whole unit necessarily doesn't have a very high population. And so they can reach out and get damage control permits to harvest even out of season when they're dealing with some of that. So we're constantly evaluating that and trying to make changes as we can.
Thank you. Senator Tyson has a question.
Thank you, Madam Chairman. So who makes the decision on the deer? Is it you or is it a committee, or who's the deciding?
So we have an internal committee that reviews everything with the data. Part of my job is to pull all the information across the state from population surveys, harvest surveys, landowner opinion complaints, deer vehicle accidents we also take into account. We look at wildlife disease in deer and all that. I make a recommendation, I put it together, it's reviewed by our internal committee, then it goes up through our administration for final approval.
And if I may, who's the internal committee? Who puts that together?
Eventually, so that's made up.
I mean, this is a big impact to Kansas.
And so our internal committee is made up of biologists from across the state that are on our private lands biologists. We also include our public lands biologists because they have a much greater number of hunters that use our very limited public land in Kansas. And then also our law enforcement staff.
So I have concerns over this. Maybe it needs to go to the Wildlife and Parks Commission as a final check too, because, well, it does. You didn't mention that.
We bring it to them prior to the season to look at.
Okay, I just have concern. This has been going on for years, and you say unlimited permits, but it doesn't matter. The gun season, you know exactly where I'm going. Yes, he does. The gun season is limited very limited in scope. And most of the people that would be taking care of the deer or helping with the deer population are not bow hunters.
It's kind of a balancing act, Senator.
It hasn't been balanced,
It's
though.
well, you give people too much time and they procrastinate and don't hunt. Something we've found as we've expanded seasons. We do provide additional time in January to hunt deer. We've considered potentially in some areas even going to possibly an earn a buck type system where you have to shoot does prior to being able to shoot a buck. Because in some cases, it's not so much that we don't have enough tags in an area, it's that hunters are not shooting enough or they're tying up property so other people can't get to it. And then we end up with a case where somebody comes and shoots a buck and leaves and no does are shot at all. And the real key to population control is harvesting does.
Well,
so
again, I'll respect the committee's time. This is a big issue, especially for my constituents. I get stopped often on it. And I will also bring up the turkey season as a disappointment that it's been canceled for the fall season. I hit a turkey last week. You know, you say there's a shortage. Come to my area. There is not. It was a complete flock of turkey, and I thought that last one was going to get off the ground, and he didn't. But no, there's plenty of turkey out where we're at too. Thank you, Madam Chairman.
Thank you. Committee, other questions at this time? Not seeing any. Thank you.
That's on the elk reg there. So moving on to 115-25-9A. This reg concerns our military deer seasons. I believe all of our regulations, we've set durable dates for seasons. This is the only one we have left without durable dates. We have to set it every year because we have to coordinate with Department of Defense on when we are allowed or when we can allow hunting on Fort Leavenworth, Fort Riley, and the Smoky Hill Range. This issue went before, we ran a temporary reg before the State Rules and Regulations Board, and they approved the temporary regulation on October 11th, which will cover us for the November 16th and 17th dates on Fort Leavenworth. Otherwise, the permanent regulation should cover the rest of the dates. So unfortunately, we have to run this regulation every year once we get the approval from Department of Defense. Although my hope is sometime in the future we could maybe work something out where they could give us durable dates. We wouldn't have to run this every year. But I don't know if that would be possible. Are there any questions?
I was going to say thank you. If I was going to wonder if you had any more comment on the regulation, but are we having any questions on this regulation from the committee? So not seeing any, then thank you very much. And thank you for your service for in your new position, I suppose. So at the Department of Wildlife and Parks. So
Yes.
A month into it, you said. So
Yes, only 1 month. So thank you very much for the warm welcome. I appreciate it.
absolutely. Well, thank you for appearing here in committee and your testimony and answering questions. Appreciate it. Thank you. With that committee, then we are ready for discussion and comments on proposed rules and regulations that have been proposed and brought to us today. We'll go back and start with the State Board of Pharmacy. Are there any comments or statements proposed to be included with our committee report? Representative Wassinger.
Thank you, Madam Chair. I should have asked more questions while they were here. They say that there's a huge problem with drugs being delivered and being destroyed. There are no numbers. There's no one telling us how often it's happening. And they just say, oh, 50%. Where did you get that number? Is it all in one area? I think we need more information from the Board of Pharmacy. I tend to not necessarily trust them. They try to sneak things by. And this is another example of, and a lot of these is poor legislative work on controlling how rules and regs are taken care of and how we are able to question them and tell them we don't think that they should be able to do things. So I would like to add that to comments.
Other thoughts on that? Representative Carmichael.
Thank you, Madam Chair. I have the greatest respect for my friend, the Vice Chair's observations, but this is a circumstance where I don't think we need that additional information. Just to explain very briefly, first, I've been to healthcare providers, hospitals in my district who tell me that it is, in fact, a real problem that Federal Express will deliver white bagged drugs to the hospital intended for a particular patient in the hospital, but they have no notification that the drug is coming or what it is. And sometimes those expensive and life-saving medications end up on the same loading dock with everything else that Federal Express delivered that day. I think there is a true concern about what's going on with so-called white bagged drugs. The other thing that I might share on that point is that seldom do I see letters from both sides of an issue, from the pharmacy people, from what I think is a group that supplies white bagged drugs, from a hospital association, with everyone saying, you know, we did work together. And even though I think in the written testimony we have, there are some who wish there were other provisions, but it looks to me like they've actually done their homework on this, and it does, at least in my judgment, address what I believe to be a problem. So, you know, we have this occasionally on this committee that sometimes we see the issue differently. If we do raise those questions or make those observations in the report, I hope we'd make note that there's not uniformity of agreement on this particular point, with respect to my friend.
Thank you. Representative Wassinger.
Thank you, Madam Chair. I appreciate the comments. But one thing you said to me is I think they've done their homework, but they didn't show their work. And when we were in school, you had to show your work on how you solved an equation or whatever you did. So I still feel like they need to send us that information. I'd like to see it. Thank you, Madam Chair.
Thank you. I do note in a letter provided to the committee chair, did the whole committee get that letter from the Board of Pharmacy? Yes. That it did mention in passing some information about some studies, but I don't think that was provided in any of the documentation. So it would possibly be a good idea to, like you said, Representative, show your work. And it looks like perhaps they have that gathered. And if they could distribute it to the committee, that would be very helpful and beneficial. So I would like a statement in the report that we would be requesting that additional information. And if there's not unanimous consent to that, then the folks who want that so noted can do that. Yes, Senator Francisco.
Thank you, Madam Chair. So I'm a little bit concerned because this seems like, again, that the testimony is all saying, if this happens at all, it's not a good thing. So I'm not sure if we knew if it happened 3 times a week or if it happened 10 times a week, how that would change our opinion about whether it should be happening at all. I don't think there's anybody here who thinks that if a prescription is being delivered and there's a requirement by the manufacturer that it be kept at a certain temperature, that even if it's 1, that should not be kept at that temperature. So I'm just wondering how more information might change the committee's comments regarding whether having those requirements to keep, to inform about deliveries would change.
I think it's probably a matter of a complete record. We did see in the letter from the Board of Pharmacy that they have received reports. So if that's something they can provide to us, just for a more complete record, not that it might change anything, but just to have us be fully informed and be fully transparent about proposed. This is actually a new regulation. We haven't had this before in Kansas. So I think fully informing the committee would be um, an important thing to do. Yes, Senator Faustido.
Thanks, Madam Chair. I'll just share this. So about a year ago, in Wichita, via Christie Medical Center, so we were invited to a luncheon with providers and CEOs of the major hospitals. Wesley Medical Center, via Christie, are in my district, and we did hear about this particular issue. So that was a year ago. I don't know how, how what has, if it's expanded, multiplied from when we heard about it a year ago, but it was a concern at the major hospital in my district. Thank you.
Well, it sounds like the board has done its homework, and I don't think we were all at that Via Christi meeting. So, so it would be perhaps an educational item to share with the committee about those reports that others haven't yet heard. So, um, in the um, in the vein of full disclosure, I think it would be important to have that information disseminated to the committee. Thank you. Committee, any other comments for the State Board of Pharmacy regulations we heard today? Then let's move on to the Kansas Corporation Commission. We heard about workplace drug and alcohol testing programs and a few other items as well. I don't see any proposed comments. Board of Nursing. We were hearing about refresher courses and as well as some definition changes and other regulations. Not seeing any. Kansas Real Estate Commission. Courses of instruction, fees. Department for Children and Families. Representative Carmichael.
Thank you, Madam Chair. Let me lead off by saying that I do appreciate DCF's representative getting back to me before this meeting was even over with the contact information for their general counsel. And so I certainly intend to follow up personally. But as I believe Senator Tyson suggested, that the concerns that I voiced ought to be made as a part of our request or comments. And in particular, I was asking that we have an explanation of what the due process rights of individuals who are subject to these determinations are. And in particular, I was thinking about their right to notice, their right to hearing, their right to examine witnesses, their right to present evidence, their right to a determination by a neutral decision maker, and their opportunity to appeal to the district courts and or the appellate courts under the Kansas Administrative Procedures Act. And I know other members have other concerns, but those were specifically mine.
I had raised some of those concerns as well with my questions about, well, do they get legal counsel and what kind of due process are we talking about? Because we always want to make sure that proceedings are fair for everyone involved, and especially while we're protecting children as well. So I think those are appropriate statements. Senator Francisco?
Thank you, Madam Chair. Although it's not a change in the regs because we are eliminating affirmed perpetrator, I would ask that the department explain to the committee why they think there should be why they think the definition of substantiated perpetrator and perpetrator should be the same.
right, any thoughts on that? All right, any objections? Not seeing any. Representative Penn.
And Madam Chair, thank you for the recognition. As you know, we went quite extensively back and forth with the representative from DCF. My concerns, and I wanted to thank the representative from Wichita bringing up the due process, and it makes it very hard to argue with him when he's talking constitutionality. So kudos to him. But the concept of the agency removing an affirmed perpetrator, I didn't feel like I got a satisfactory answer as to why they wanted to do that and what the implications of that would be far reaching throughout that landscape involving the care of children. What would be the impact and implication of that? I think that the committee should note that and try to get some type of resolution of that impact before this is actually promulgated. Thank you.
Thank you. Any objection to including something like that in the report? Senator Francisco.
Thank you, Madam Chair. I do think they tried to address the issue that they do not keep. They have the history of allegations, but they do not have a special list for affirmed perpetrator. So I think this question will just put that in writing, that they have the history but not the information, and so seeing that might be helpful.
Thank you. Committee, other thoughts, or not thoughts, but statements we want to include in the report on the Department of Children and Families? Not seeing any. Then Department of Agriculture. Yes, Representative Carmichael.
Thank you, Madam Chair. There's two areas that I'd like to bring to the committee's attention. First, I'm not disparaging the person who testified, but I don't think we received a clear explanation as to under what circumstance a charitable or nonprofit type entity would be exempt from these regulations. And if they could just describe for us what that is, because I think the representative was saying, well, it may be somewhat vague, or perhaps they were somewhat unsure of how this works in particular instances. Yeah, I think it'd be helpful to everybody involved if we had a clear statement from them under what circumstances are these nonprofit or charitable entities subject to these regulations. Otherwise, I have to go back to the church board and say, I don't know if you can sell poinsettias anymore at Christmas time, and I don't think that was their intent.
So we're asking for a clarification.
Just a clarification as to under what circumstances are charitable and or nonprofit organizations subject to these regulations and these regulatory fees. There's a second area I need to address. But
sure, any objection to including that in the report? I'm not seeing any. Go ahead.
The second concern, or whatever, I do recognize that my good friend from Wichita or Bel Air or wherever it is in the northeast part of town, by the way, I apologize for the bad joke I made the other day. I said, well, that fire's up in Representative Penn's district. That's not concerning my constituents. And turned off the TV. I did not mean that seriously. Representative, my parents and I, we lived there for 30 or 40, 50 years in your district. But I think the representative expressed concern about the analogy to be drawn for veterans receiving zero fee or no fee for professional licensure. And I think that is a little bit different statutorily and conceptually than what the Department of Agriculture is doing here. These are fees for inspection of a business, if you will. And the statutes that we have passed to remedy the problem of itinerant military dependents, not because they want to be itinerant, but their spouse has been transferred to Fort Riley, has to do with professional licensure and not charging these folks for their professional licensure and providing pathways for prompt licensure. So when they arrive with their spouse at Fort Riley, that they can continue their practice in local hospitals, even though they're not originally licensed in Kansas. That's a 0% fee. But I don't think that dependents of serving members of the military should be exempt from all regulatory fees. For example, if a military spouse opens up a restaurant, I don't think that means that they should get no inspection or free inspection from the Department of Agriculture for food safety. Rather, I think in the competitive marketplace, they probably ought to be under the same rules as anybody else who runs that type of a business. And I think that the regulations we're looking at here, having to do with registration fees for plant inspection, etc., fall more properly within the concept of regulations that apply to anybody and everybody, rather than zero cost licensing for military dependents. And so I don't think it's the same thing with respect. And I don't know we need to put that in our report, but I did want to address my concern that we might be mixing apples and tomatoes.
So in the statute that was passed in 2024 on waiving the registration fees for military members, does that address, do we have a reference to what statute that is? And if it's already in statute, then I'm thinking they're proposing the regulation because the statute gave them the authority to waive the registration fee if they saw fit.
Madam Chair, if I may.
Yes,
In,
Representative Penn.
thank you so much, Madam Chair. In the interest of time, if we can send that over to KLRD to take a look at that and find out if House Bill 2066, as well as the measure that we passed last session in 2024, speak to that directly, then we can add that note. But I do understand the gentleman from Wichita, what his reasoning is. I do concede that point if that's indeed what the nature of the letter of the law and the spirit of it is. More so, I was just talking about it in the concept of we are trying to incent business and small business to be here, especially for military spouses. So if there was something that was a barrier to that happening inside of Kansas, might the agency be receptive to lowering or putting at zero the cost of those fees? But if that's not the spirit of the law or the letter of it, then I do concede the point, and I thank the gentleman for having that incisiveness. Thank you.
Thank you. If we could make that request from KLRD as part of the report, and I think that would address the concern. So, well, great. Any other comments for the Department of Agriculture? Yes, Senator Tyson.
Thank you, Madam Chairman. I would hope that the committee wouldn't mind if we made a comment about their fee increase, such as a substantial all at once. I understand it's been 20 years, but that means you should have been taking a look at it across the board, not just saving it all up for the current businesses to feel that burden. Thank you.
Ms. Shelley, is that something you feel comfortable putting? I don't know how you would word that in the statement is what I'm saying, the wording, that the committee notes that while it's been 20 years since the fee was increased, to do that all at once could have an economic impact, a negative economic impact on Kansans. And okay, and it's recommended, take a look at it along the way, and rather than let it be so extreme all at once. Any other comments for the regulations from the Department of Agriculture? Not seeing any, then that takes us to Department of Wildlife and Parks. Any comments for the report? Not seeing any, then that will conclude the discussion and comments on the proposed rules and regs. And committee, at the end, we always get our calendar out to take a look at when we need to statutorily meet because there are statutory deadlines when rules and regulations are proposed as they go through the process of being reviewed at the Secretary of State's level and a Department of Administration and Attorney General as well, and then the legislature. So we will need to have a meeting in mid-December to meet those timeline requirements. And for mid-December, what does KLRD propose for a couple of dates? Or should I pick some? Yes, Senator Francisco.
Thank you, Madam Chair. I heard a comment that we might need to coordinate with the special committees, but also just to let you know that December 16th and 17th have been set aside for meetings for the Joint Committee on State Building Construction. So that would affect my calendar.
Madam Chair.
Yes, Senator McGinn.
I was curious if the 11th would work.
Well, so December 11th has been suggested. I'm not seeing any opposition.
I'm sort of at a disadvantage. My colleague, Senator Faust-Scudeau, had the entire list right here of the special committee meeting dates. And I don't know what day my special committee, it's some kind of a sandbox I'm going to. I don't know what we're going to do there.
Well,
but I wouldn't want to miss it.
Right, and that's great that Senator Faust-Scudeau has that list, and we could have used that. But we do also have Ms. Shelley, Kansas Legislative Research Department, who I think can give us some insight into what interim or special committees or standing committees might be meeting on December 11th.
At the moment, I'm seeing none.
Wow. Well, maybe Senator McGinn looked ahead and saw that that was a blank date as far as the legislature's work.
I have meetings on both sides of that day. That's why I was curious if the 11th would work.
Sure. So we're looking at December 11th. I'm not seeing any problems with that as far as the calendar. So let's go ahead and schedule that for December 11th.
Thank you.
And for a 9 o'clock start. Seems to work pretty well. With that then, committee, that concludes our work today. Thank you everyone for hanging in there. I know we're adjourning a bit late. We did have a lot of regulations and a lot of questions and discussions. So thank you for your attention and to those following along online as well. With that, thank you to the staff for getting us prepared for today and for being here and helping, assisting with the meeting, and to committee members and those following